Zoom link is 9:01.
Yeah, Zoom is only 8 to 12. I found out from Dr. Hogan.
Oh, okay.
And they say it's going to be recorded, but they don't know how it's going to be rebroadcast, whether it'll be on YouTube or not.
Now we need this. We have a right as an employer to do it. Every court has shown that we are right. We have that right.
Any questions now?
Oh, thank you. I'm great, thank you. Yeah. So this is all fun to do. You know, this is such an important thing to do together. It's been
We can move over here.
and so I think we're. So is it up and running?
Black people in the U.S.
You see me?
3 times more likely than other racial groups to be killed.
Please unmute everybody so we can hear Dr. Hogan.
Here, you know, we're going to be having a few lectures this morning here, some interesting aspects, and then we're going to Tom and this afternoon, but time for questions and it'll be moving with some dance and some questions. It'll be a fun day. That's the whole point of this. We have a pretty enjoyable Saturday.
Yeah.
Is needed to ensure that all deaths and injuries.
No, it's gone.
And recommend.
Joan at the symposium, can you hear us?
All right, so anyway, so in the spirit of Halloween, you know, we can characterize dystonia as this unwelcome,
Joan at the symposium, can you hear us?
Creature, monster that came into our home. And despite our best our hospitality, they give you more nasty tricks and new treats, you know. And so, and then this monster has this ability to mask itself in costumes that can disguise itself and avoid recognition for years sometimes. And as everyone knows here with dystonia, sometimes it takes so long to the point that you can actually make that recognition until you see that magic person that says, you have dystonia and your life can change. Finally, this is what I have. So, you know, our point of goal in today's conference is to deal with the medical aspects of treating dystonia since that's
and Canadian organizations Stonewall and Rainbow Railroad. Conservative Foreign Secretary Liz Truss has released a statement saying it's hoped they'll be the first of many lesbian, gay, bisexual, and transgender Afghan arrivals, adding that Britain will continue to defend, quote, the right of all people to be themselves and love who they want. Or NPR.
I don't know how to do it.
In London. In Cleveland, the Rock and Roll Hall of Fame inducts the class of 2021 tonight, calling it the most diverse.
I think a lot of people haven't muted themselves.
Yeah, we need a.
King, the Go-Go.
For people that are on Zoom, maybe be sure to good future.
What if we just go like this? No, I just plugged this in. So it thinks it's a headphone.
Okay, tell them to mute. Everyone needs to mute.
Everybody mute your phone. Never hear any feedback.
You can have her.
I think you can do it.
Yeah, we can do it too, but I've asked them.
There you go.
I don't know how to do this.
With the country, you
You know how to do
Well,
it?
yeah, you click on the person and you know. That one's me.
Oh, I see.
I could unmute myself too.
It came out.
Some may not. You will.
Good. There we go. We got.
Okay.
That is the mute on that.
It's right here. It's gonna work.
Should I go ahead?
Yes.
Yeah, go ahead.
That's okay. So going back, what do we do with this monster? You know,
So this is
so you know, the
audio.
whole point of this conference is not so much to deal with the
Yeah, I
medical
gotta mute all
aspects
these,
of treating dystonia. We've been through a lot of and we'll get this afternoon. We'll have plenty of time to talk about some of the you know true medicine aspects of dystonia. So today we're really going to talk about, you know, what can we do with self-care to help tame this monster. If we can just put him into the corner, make him curl up and just be quiet, leave us alone most of the time, that'd be great, you know. If not, just at least make him behave a little bit so that it's less impairment in our life.
I'm
You know,
gonna go double check my
so what is
audio feed.
dystonia? You know, we can think of dystonia as, you know, as this, well, let's just say that the other way around, is that people that don't have dystonia, you know, they just take this for granted. You know, that this nice stream of energy is flowing through all the muscles in our body, and you can control it as well. And we can think of dystonia instead of having this river of energy that's flowing from one aspect of the brain onto specific muscles, whether they're the eyes, the jaw, or the neck, or the larynx, or the arms, you know, or combinations most often of one of these that produces this out of control river. And our whole goal is, what can we do to help calm down them, or put a gate or a dam up against that energy? So, you know, so dystonia, you know, at one time we always think, well, it's coming from the basal ganglia, this movement control center. But now we're realizing that, you know, it's really multiple regions of the brain that seems to be involved. You know, that there's really an interconnection with all these circuits in the brain, and these circuits interconnect with each other with chemicals, they're transmitters that transmit messages from one part of the brain to another part of the brain. And our goal is how do we suppress, how do we control those messages? And so so we have medications, you know, we have medications that can kind of moderate some of those chemicals. We have deep brain stimulation into the basal ganglia that can maybe kind of override some of that overactive impulses. We have the botulinum toxins that are involved with, you know, that as you know, bring the messages from the overactive energy down to try to get it down to the normal, as much energy as possible. You know, they all work pretty much the same as we inject the botulinum toxin into the muscle. It attaches to the nerve, goes inside the nerve, is coming down from that overactive brain, and then putting some blocking effect on the energy. Not 100%. We don't want to paralyze the muscles, but calm down. And that's the key. Just how do you calm it down just enough? And that's why, you know, the botulinum toxins is so different than other medications. You take a pill and it works or it doesn't, you know, type of thing. Here it all comes down to the precise precision of where to place that and how much to place it. And that becomes the art of taking all this information together, where the eyes, jaw, or neck are moving, decide which muscles of the 50 muscles in the neck are involved, and then making that judgment based on the EMG recording, on feeling what the muscles feel like, but mostly the art, you know, the feel. It's something you can't even teach, you know, that over the years of experience, people learn, you know, where is that energy actually coming from? So you make your best judgment of where it happens. And the only problem with dystonia too is that this monster tries to trick us, you know, and it's not always the same every time. It says, oh, okay, so you calm down that area, let's switch you over here, we'll trick you. And then we got to be constantly making that adjustment. And so we see that if people come in and says, oh, I don't respond to Botox, for instance, and so I'm not going to try these anymore. Often sometimes it comes down to finding a different toxin even, you know, Seaman has been a major step forward because it's in a more purified form for some people, and it's a matter of finding which toxin works, and then making those decisions on which muscles can be involved. So it's all part of the art and precision. But so today we're really going to want to talk about some other aspects, because in the 30 years that I've been, 40 years I've been treating dystonia, and 30 years since I started using Botox therapy for dystonia, reality, things haven't changed very much. We had all these promises and hopes and that we're going to find this breakthrough and we're going to be controlling this disorder, this hope for a cure for dystonia. Well, things haven't changed much over the last 30 years. And so while we're patient and while we're and why we're having faith that, that something is going to happen. We've got to do something else, you know, and all these treatments are extremely important, but yet we have to, what else can we do for ourselves? And that's the idea of our discussion this morning, is this whole, what can we do for the principle of neuroplasticity, which means what can we do to help do some alteration in our brains itself? What can we do to help make a difference? And people here in this audience, I've seen around, people have taken this to heart. And there's so many people here that really work so hard on the whole principle of trying to do what they can to change their brain. Because the idea is that although sometimes dystonia can be who you are, it can take you over, you know, the reality is you want to have as much as possible for dystonia not to be who you are, to be able to put it aside as much as possible, and then to treat all aspects of yourself, the whole person, to produce these neuroplastic changes, these changes in the brain that are possible, but take the right type of work. But it requires, you know, making your brain healthy. You know, we may not be able to control the overactive impulses to some degree on our own, but we all have the ability to make our brain as healthy as possible. The healthier your brain could be, the better you know, the dystonia can be controlled. But everyone knows here that when the opposite happens, the dystonia gets worse. When you're more stressed, when you have more, when you're not sleeping well, when you have some viral process, if if things are upsetting in life, the brain gets stressed and it starts losing some compensation, and it turns up the juice on the dystonia, and people start having more tremor, and they have more anxiety, and so the idea is, how do we keep that energy down as much as possible, with keeping your brain healthy. And and over time, I've done this lecture specifically on this topic. You have these in your handout, and if anybody wants it on Zoom that doesn't have their list of all some of these our checklists, we call them our 10 commandments. There's so many things that you can do for yourself that we'll be bringing up somewhat today, but not as much detail as I've done the full lecture on this topic. But you would definitely bring up the concept of exercise and meditation and nutrition. Joan, we're talking about nutrition in the brain, and what you're doing here with being networking is one of the best things you can do for control and just the anxiety and the acceptance of dystonia. Our attitude, Tom's been talking a lot about that. Be your own health advocate. You got to know what's out there, and don't let people just blow it off, by not caring. You want to make sure you're with someone that really cares about you when you're being cared for dystonia. We've talked about travel. The whole idea is something to look forward to, something to have hope that some things can get better, and look for things that you can do in the world, or just plan it. You don't have to go on vacation, just plan a vacation. That's some of the best parts of it. And then the whole concept, again, where we talk quite a bit about is the whole principles of neuroplasticity and the Farias technique. Some people, I believe, benefit from Dr. Farias's program up in Toronto. In the last page of your handout, there's some new seminars that he has coming up. And it's not the whole cure, obviously, but again, one part of the puzzle to help do whatever we can to produce that change in our brain that we need. So we're going to run through this quickly because we want to get through different aspects. But people are asking to bring some comments about what else did we suffer with dystonia? Because people always talk about the movements and the pain and the tremor. Well, it's not the whole thing. The people deal with lots of other things, and well, what's wrong with me? How come I'm having trouble with balance, or ringing, or anxiety, depression, migraine, and so forth? These are often components that are very commonly associated with dystonia, but sometimes it's just not brought up very much in medical conferences, and everybody are just so attuned to what people are looking at. It's actually which muscle is active or which muscle is moving, rather than actually looking at the whole person again. Because these things can be just as impairing to people, even as the altered muscle activity itself. And so how about balance? Because it's really true. Many people with cervical dystonia and any other type of dystonia have experienced dizziness, even vertigo, this spinning sensation. And if you go to most physicians, they're going to say, well, that's just your inner ear, and so feeling off balance when you're walking, really common, and we'll talk about what does proprioception mean. And because the brain is trapped in this black box in your head. And unfortunately, it doesn't have any way to know what's going on in there except by the input that's coming in from your eyes, your inner ears. And that's what people really think about is that the whole vestibular system, this inner ear section of your brain, inside your head that gives you messages of where your head is and at any specific spot. And that's really true. If you have some problem going on with your vestibular system, you're definitely going to have trouble with vertigo or balance issues. But it's not the whole thing. Neck, if you can see that, it's neck proprioception. Your brain receives impulses, and not just from your inner ears, but from your eyes, your ears, and your neck, and your body. Proprioception means feeling where your body is in a special time. And if your head is off to one direction and your brain is feeling that message, well, you must be turning. Well, maybe you aren't turning, but it's just giving you a feeling of that projects back to your brain, and your brain has to deal with whatever impulse is being received. It's kind of stuck. And so the whole idea is that with people with dystonia, very often have difficulties with equilibrium, with balance problems, not just because of the vestibular problem, but maybe because of blepharospasm or spasm in their eyes, but especially trouble with the overactive impulses in their neck that then feed back and can act just like someone with the inner ear problem. And so we have to think about this whole thing together, and to be able to stand in a good yoga posture really requires a lot more than we take for granted is happening, but that's really kind of the treatment. The treatment is to give the message to your brain, and everyone here knows about what we do with exercise and therapy if necessary, to try to give the brain that messages to produce that neuroplasticity to adjust to the alteration to help improve your balance. So I'll just leave it at that, because more we can talk about that later if you'd like to. Then how about the ringing in the ears? Well, how could that be related to dystonia? Yeah, well, it's so fascinating how often this happens. I know some people in the room here already. I can see that when as their botulinum toxin treatment is wearing off, they'll say, "I know it's wearing off because my ears are ringing again." And it's so fascinating. And again, it's something that's hard to ever mention, but it's it could be a ringing or a buzzing or a humming, all sorts of bad things. But it's horrible. It's a horrible problem for many people. There's people that feel like they can hardly go on because of this noise inside their head. Now, many times it is coming from the inner ears, from noise trauma, hearing issues over time, and from the inner ear, from the actually the nerve to the inner ear. But when that happens, actually the ringing in the ears is coming from the brain trying to fill in the loss of sound. So in other words, if you're losing a certain frequency because of hearing loss, the brain says, "Oh, I don't hear that, so let's just make that sound up." And so he starts bringing you that ringing or hissing or whatever we may experience. But the other one is, it's so fascinating, is this thing called tensory syndrome that can be actually a dystonia involving the ear. And there's the tensory syndrome. What is it? There's some really good articles in the literature now that they're suggesting that this muscle tensory may be overactive in some people with dystonia, that is then impairing the function of the inner ear. Normally that muscle, what it does, it kind of dampens the sound. If you didn't have that, everything would be really loud and hypersensitive, which is really a problem with dystonia because we're already hypersensitive, but if this area if this is overactive and there's excessive activity there, it can actually be producing an alteration in the ear mechanism to produce a abnormal sound. And so we're just assuming that maybe that's why people get better with toxin, because we're not injecting into that muscle, obviously, through the skull, but so often, just by doing some bystander toxin around the outer aspect of the ear or to the upper part of the neck, it just settles, it settles down the noise. It's fascinating. We don't talk about that very much, but it's an absolute reality that I've seen for the last 30 years in treating this condition. So just one other aspect that people might not be aware of, but you should bring up to people that you care for, or they're caring for you, because they may not realize it, that this could be actually related to part of the primary dystonia. So, and then how about anxiety and panic? Is that, am I just crazy? What makes with anxiety, and is this something totally separate? Well, it's the same with a lot of neurological disorders, actually, is that the brain has this delicate balance going on. And people with dystonia, it just, people with dystonia are really nice people. That's the thing. That's the thing about dystonia. It's almost like a way your brain is made, but at the same time, the brain is hypersensitive. It's kind of it has a fragile, higher level sensitivity than the I don't want to say the normal brain, the usual brain. The poor people that don't have dystonia, and so something happens, and there's this feeling of this fear of the unknown, that it can really be part of the sense of dystonia brain. And so people, they really want to bring it up sometimes about their anxiety and their depression, so this is something that's not really neurological, but it is. It's all part of how the brain works. And but what you're doing today is learning about dystonia. Being involved with other people is very important by itself. May require medications, sometimes to help, and we do that. It's okay. And we have a supplement that we use pretty often in the office called Serotonin, that actually has more of a natural mechanism calming down the brain. A lot of people really like something like that that's natural. And then meditation. Meditation can be better than medication. Meditation can be better than medication if you can allow yourself to bring down that energy with training. And sometimes it's maybe not even anxiety. Sometimes people have a tremor. When people have a tremor, sometimes it's almost like this little feeling of an earthquake inside their chest. It's like it really feels like anxiety. Sometimes it's all part of the dystonia disorder, and often responds well to controlling the tremor in the neck or wherever it is. So it's one aspect. And then depression, again, definitely could be reactive. Sometimes, as Tom will talk about, it sucks to have dystonia, and he'll get into that. But then there's the neurochemical aspect too. Again, it's a sensitive brain that can be involved, and Tom will talk about that. And then again, be involved with networks, so you're not isolated with this, and realizing that you're not alone with this disorder. That we have these groups, and we have people around the country that really understand what's going on. And if we use medication, sometimes it's needed. We want to, especially if people this is again, so your care providers know this, that you don't want to do something that blocks dopamine. There's medications antidepressant medications that have some dopamine blockade effect that actually can potentially worsen the dystonia. So we try to use medicines, such as duloxetine, Cymbalta, that's an example that often works good for people with dystonia. So, the attitude, the thought really makes a difference. Thought, thinking is just not just some, just some electrical discharge going off in your brain. The positive thinking really can make a difference in the neuroplasticity of your brain. It's been really well shown in so many books, with in the Telomere effect, the epigenetic revolution, all these really well documented neurological studies that have shown the epigenetic change. Epigenetic means that even if your genes tell you one thing, it doesn't mean that you're stuck with that. You can make alterations in how those genes are expressed by the right type of lifestyle changes, the right type of attitude, exercise. All these things can actually do it to have a change in your brain. And attitude and positive thought are one way of having epigenetic changes. Sometimes that's really tough, and people have said, yeah, sure, that sounds good, but it's hard for me to be positive. I totally understand that, but it's something you have to work toward as much as possible, because that does make a difference in how your brain works. And then just real quickly, let's mention this overflow. Some people just don't know that word because they think, oh, I'm getting generalized dystonia because my neck is bothering me, now my arm is hurting, or now my neck is bothering me, now my jaw is tightening. Well, there's this thing called overflow, that even if your energy that's flowing through your brain is building up in one section of the to one area, it can overflow to other areas. So very often when people with treatment like the botulinum tox injections are wearing off, the first thing they realize, maybe not their neck moving, for example, but their arms cramping, or they're getting tingling, or they're getting increased jaw spasms, or their larynx is getting tight. And so it's this thing where it's like a cup that fills up, and at a certain point it flows over to the legs or the arms, and so it's reassuring for people to know that it's not necessarily that you're getting a generalized dystonia when you have focal dystonia, but it's it may just be an overflow, and if we just suppress that original area, we can settle down. And then the last thing I'll mention today before going on, it's about migraine. This whole process of this brain activation that triggers the release of CGRP that so easy to talk about in a minute. And this is something that's really fascinating because in the general population, only about 20% of the population has migraine. But I've been kind of keeping track, even in our own. This isn't this nationwide study, but in my own clinic, that over half the people that have dystonia, whether it's neck or jaw, especially, and almost everybody with blepharospasm has some little pain in their head. But a true migraine, migraine with light sensitivity and sound sensitivity, and it can be all part of dystonia. So I think it's all part of the hypersensitive brain, because that's the part of what migraine is. Migraine is a disorder in which your brain has become hypersensitized, just often hereditary based, and it's sensitive to different stimuli in the world. And so these stimuli can trigger migraine. So he will talk about that in a second. But neck spasms and pain can trigger it. And we're just so lucky to be in a phase of history for the past more than, I would say centuries, actually millenniums. There's the documentation of people having migraine. And for hundreds of years, people were drilling holes in people's heads called trepidation to let out the bad humors or something, because there must be something wrong with them. They have this intensity of pain. And so they have these documentation skulls over long periods of time where people were drilling holes, and had to drill a hole in the head, they either didn't survive or didn't stop complaining, I guess, so that was the treatment, because it wasn't just a short term, it was long term. So unfortunately, just in this very short period of time, the last 20 years or so, that we've actually had really effective treatments for what actually causes migraine. And fortunately, with our treatments that we're using, that is controlling the dystonia, often it's enough to control the disorder. So we have next coming up is Sohee Kim. She's a really excellent nurse practitioner. It's in our office that's been doing migraine and botulinum toxin for years, and now is doing a really good job of doing some cervical dystonia treatments in our office, and progressing her skills on that. Also great. Today she's going to be talking about the whole principles of migraine and what we can do about it. And then we're going to hear from Joan for nutrition. So we'll just keep moving along.
Can you take a 3-minute break so I can switch the audio input to the
Would you want to do that?
okay, I think it'll take like 3 minutes.
Okay. Oh, is that right? Is that happening?
Yeah, right now they're just getting the sound.
Oh, that's on. Do you know how it is? Or people experience that?
I don't know.
Yeah, if you want to, it's not, it's okay. Okay. I think we're gonna be okay. I hope it's okay for people on Zoom. I hope you're okay. We're talking about, we're trying to hook up a different set, but it's gonna take a little bit of time, and we can do it a little bit later. But can maybe Tom talk to because okay, let's just do it. Let's just have so he come up first, quick. So then, yeah, let's go ahead and go on so we can stay on track here. No, we're almost on the right track. Amazing. So we'll just keep going and we'll hear from us. So
Hi, good morning, everyone. As Dr. Hogan introduced me, my name is Sophie Kim. I'm a nurse practitioner specialized in headaches and cervical dystonia. I've been a nurse practitioner at the Development Center since 2017, treating migraine patients, and then recently joined to Dr. Hogan's practice, working with patients with headache and cervical dystonia. Can you hear me well?
a little closer.
Okay. So today I'm very honored to talk about migraine in front of all you all because I heard about the story and history about this meeting in the morning. I should have known better before. It was a really long history and then with all the support group. And so I'm really honored to talk about. And before I start today's topic, migraine associated with dystonia and its treatment, people might wonder why migraine, not other type of headache. Out of all kinds of headache, tension type headache is the most common headache in the general population. There won't be many people who say, I never had a headache in my life. But the migraine is the most common type of headache disorders for which patients seek for treatment options. And migraine is the leading cause of disability in the US and globally due to the severity of the symptoms and its impact on their lives. Besides, I've seen quite a lot of patients already since I started at Dr. Hogan's office in summer who have been treated for cervical dystonia with fairly good control of neck pain and movement, but found to have very frequent headache and migraine, especially that has undertreated, I would say undertreated, as they've been focusing on the cervical dystonia treatment. So I'm going to go over with you what migraine is and the treatment options, what treatment options out there. So what is migraine? It's a lot of words, so I will read really focusing on some letters. So a cerebral is brain hyperreactive disorder. So similar concept to cervical dystonia. So brain is hyperactive and it's often hereditary, so familial, and that activates electrical phenomena in the brain and trigeminal-vascular system. And this produces multiple brain dysfunction symptoms such as aura, cognitive changes, speech therapy, changes, and nausea or allodynia, and intense pain along the multiple projection pathway. So allodynia means pain caused by non-painful stimuli. So it should not cause pain, but it's causing pain, such as combing your hair or touching your scalp or washing your hair or touching your face, something like that. From this description, you can tell that migraine is not just a headache and it's systemic neurologic symptoms disorders. So official definition of migraine according to the International Classification of Headache Disorder, 3 beta is the 3rd edition and beta version. I don't know what alpha version was, but it's described as pounding or pulsating character in one side of the head, but it can be bilateral, and lasting 4 to 72 hours duration with a moderate to severe pain associated with light, sound sensitivity, nausea, or vomiting. It's a lot of words to think about. The simple recognition of migraine can be done by this 3 questions. When you have a headache, are you sick to stomach? You have nausea, or the light bothers you, or the headache limits your ability to function for more than at least 1 day. So if you click yes for 2 out of 3 questions, you're likely to have migraine. The key migraine indicator is whether the headache impacts your personal life and then your function in daily lives. So there are 4 stages of migraine. No, not everyone goes through that 4 stages. I do have migraine, but I never had aura. So everyone can be different, but there are known to have 4 stages in the migraine. So starting from the prodrome, which can last days before migraine starts, and you might feel fatigue or irritable, or you're yawning so much, or you're peeing so much, or you're craving for certain food. So sometimes that craving can be misunderstood as a trigger, but it can be the symptom of the migraine. And some difficulty thinking and nausea even. And then there's an aura phase, usually 5 to 16 minutes before migraine starts. And then only 20 to 25% of migraineurs have aura, and then we call that classic migraine when you have migraine with aura. And aura is a gradual progression of neurologic symptoms that is fully reversible, unlike strokes. And visual aura is the most common. So this kind of aura, you can't see really one spot well, and then it's blurry, and then outside of the vision, it can be colorful, like zigzag lines, and then more accentuated zigzag line in some are peripheral vision or central vision, or some people have like a loss of vision in certain spots. And visual aura can happen most common aura, but you can have motor aura, which is weakness of one side or both sides of the arm or legs, or you can have numbness, tingling, that kind of sensation before having migraine, and you can have some slurred speech or stutter, or you can't come up with the words. All that kind of symptoms can be migraine aura, and which is very confusing from the stroke symptoms. That's why a lot of MRIs and CT
Yes, I am.
ER was done because of the migraine aura symptoms. And although it's understood that there is a decreased blood flow to certain areas of the brain cortex during the aura phase, aura is more neuronal dysfunction than the large vessel occlusion, which occurs in the stroke. And I wanted to mention that migraine is highly variant from one individual to another, and from attack to attack within an individual. So some patients come and say, I have 5 different migraines here and here and that way and this way. But actually, it's often that they have one migraine with a different location and symptoms. So how migraine starts? Dr. Hogan showed one picture, and I'm going to go over that picture today too, and what's going on in my brain when I have migraine. But there are not clear understandings of migraine pathophysiology, but as far as we know, there are pain-sensitive structures, including trigeminal nerve, and then occipital nerve, and cervical spinal nerve, and so on. And then that includes the trigeminal nerve that goes to the face in this picture, like up top of the head area and the jaw area, and then the cheekbone areas. And there's a trigeminal vascular connection that produces perivascular inflammation, and that results in the excruciating pain. So the next slide shows more detail, and in the trigeminal vascular connection, CGRP plays a big role. And CGRP is a short for calcitonin gene-related peptide, and these days, this CGRP is the major target of migraine treatment for either acute and preventive treatment. So although the pathophysiology of migraine is not fully understood, It is thought to begin with a diffuse neuronal dysfunction in the brain. Neuronal dysfunction in the brain that causes vasodilation in the blood vessels in the brain, and an activation of the trigeminal vascular system. And it causes release of CGRP molecule. So it's a protein molecule, and it's a neuropeptide. And the release of the CGRP from the trigeminal nerve ending can also cause the inflammation in the nerve vasculature and the cascade of pains, the pain impulses starts. And that trigeminal like nerve irritation and inflammation can transmit to this trigeminal nucleus caudalis. It's in the back of the head, and we think that's the migraine pain center. So the pain input is delivered to the trigeminal nerve, the trigeminal nucleus caudalis. And then the trigeminal nucleus caudalis exposed to the upper cervical nerves, which results in neck pain and the pain in the back of the head. More detailed explanation about the neck pain in the migraine. So trigeminal nucleus caudalis is really hard to pronounce because I say T and C all the time, and it's my first time to say the full words. So trigeminal nucleus caudalis. So it extends to the neck and upper head through the cervical upper cervical nerves C2, 3, 4, 5 that innervates back of the head and the neck, upper neck. So it can be, the neck pain can be the symptom of the migraine from this pathophysiology, right? And it can be confusing when you already have a daily basis from the cervical dystonia. And on the other hand, as you can see in the picture, so the upper cervical nerves innervates posterior head. So when muscle in the upper cervical neck is really tight, hypertonic in the setting of dystonia, cervical dystonia, this also irritates and stimulates cervical nerves and cause posterior head pain. So neck pain can be a cause of migraine as well. And when you already have cervical dystonia or migraine, and then you have a car accident or whiplash, they can aggravate the symptom, and all of a sudden you have a very, very frequent and extremely severe migraine.
Well,
Now I'm going to talk about the common symptoms of migraine. There are so many, and this is just tip of iceberg, but it's very common symptoms. So head pain is a common symptom. So in migraine is headache, but it's a little different. Head pain is the most common symptom associated with migraine. And some people have headache, migraine without head pain, but they have aura and see a lot of spots and all the symptoms that can happens before migraine, but actual head pain is not happening. That sounds nice, right? But we treat that kind of migraine as a migraine, and there's a diagnosis of migraine equivalent, and more like a detailed term is migraine aura without migraine. So there is such diagnosis. So head pain and often associated with nausea, vomiting, and GI symptoms, including diarrhea or anorexia. You don't want to eat, and sound and smell and light sensitivity and mood and cognitive changes. Cannot concentrate, cannot think of anything, and scalp tenderness that I mentioned, allodynia, dizziness, vertigo, all that kind of symptoms can happen with migraine. So again, migraine is not just a headache. There are a lot of triggers of migraine, and this slide shows some common triggers, but these are just a few examples again. And often the triggers are cumulative. Now, identifying trigger is very important for the holistic treatment for the migraine, and this can be only be done by patients and by keeping diaries and keeping tracking on what you ate and what you did and how much sleep you had and how much stress level you had before the migraine. But, maybe I didn't mention about the migraine and the postron in the stages of migraine, right? Yeah, because I was focusing on the aura so much. So I'm gonna go back. And after the aura, the headache can start right away, or aura and headache can overlap. The headache part usually lasts up to 72 hours, and with all the symptoms that I showed just now. And after the headache, very like pounding and throbbing headache passed, you could have some hangover, migraine hangover stage, the post-drone. So you can still have some dull aches and then fatigue and all over body is really, really tired. So you can't still get out of the bed because of that hangover. So some people like me, I'm so lucky for now, knock on wood, I have this kind of like stages without aura, and then I have like a full remission of the migraine for about 30 days or 45 days, and then I have another migraine. But a lot of people who has chronic daily neck pain who can be on the continuum of that migraine stages. So never been really on the remission, and it's just after post-drone, it's just prodrome start or overlap here. So they are telling me like their migraine is like coming like a wave. So it's already there, and then it's just get worse, like a wave form. So I'm gonna go back to the trigger. So many triggers can be possible. To name a few, stress and estrogen level fluctuations. So during the menstrual period or before, you can have more severe migraine or more frequent migraine, and changes in sleep patterns, also big trigger, lack of sleep or too much sleep or interrupted sleep, anything. And weather changes. I see a lot of patients coming from LA or Arizona especially, where the weather is really consistent. They're having so much headache here when they move. I sometimes, for one patient, I asked to move back to Arizona. Seriously, because that makes huge difference whenever she visits to family in Arizona, her migraine is gone. So what's the point of giving so much treatment here and just go back there? And like light is a main trigger for me. If there's a flicker of light, like 1 or 2, I will have instant migraine. So a lot of patients with migraine have some certain threshold to the trigger. So probably I have really low threshold to the light trigger. Some people have multiple low threshold to the migraine trigger. So you are the only person who can find out what the trigger for you. And a lot of Joan will mention about the food more detail, but food and migraine can be underestimated. But I've seen a lot of patients who get rid of certain food that triggers migraine, and then they're actually out of the medication. Food sensitivity means it's not like allergy. So sensitive, something like if you're eating something that's sensitive, that you're sensitive to, can chronically cause low-grade inflammation in your gut, and then the inflammation doesn't just stay in the gut; it's traveled to the brain, and that causes more migraine. And a lot of other triggers for neck pain is right in the middle, and medication overuse. When you have chronic neck pain, it's really easy to be medicated every single day because you can't live without it. And even if it's not really completely relieving your pain, it's better than nothing. So you're just popping ibuprofen or Aleve or like Tylenol, Excedrin, like alternating. So medication overuse headache exists, and when not for everyone, but some people are taking a lot of medication. So I ask them to get rid of completely for about 4 weeks. That doesn't change anything, then probably it's not your trigger. But on the other hand, a lot of patients get benefit from coming off from the medications. So next. The goal of treatment of migraine, there are a lot of treatments, but what's the goal? Is it like getting rid of all migraine? If patient come in with like everyday migraine, and then they tell me, I want to get rid of all my migraine. I can't help you with that, but let's reduce the frequency and severity of headache so you can function better. So first, goal is going to be to raise the migraine threshold by suppressing hyperreactivity of the migraine generator in the brain. It can be done by preventive treatment that I'll go over shortly, or procedure, or lifestyle changes. And second, to avoid migraine triggers specific for each patient, and to do this, you have to know what triggers your migraine. And three is to avoid onset of migraine rapidly before allodynia begins. So don't let it go too long, and you have to treat migraine as soon as possible to get rid of the migraine, not to have that hangover period and then another migraine starts. But everyone's migraine is different. If you have everyday headache, it's really hard to avoid migraine with certain medication. So with all this, the major goal is to improve quality of life, same as in cervical dystonia and living with the migraine. So there are support group for migraine. I put the purple, not because I love purple, but purple is migraine color. For the support group, American Migraine Foundation, they use purple. American Headache Society, they use purple. So somehow purple is a migraine color. So I'm going to go over it quickly. There are so many treatment options for migraine, but I'm not here to tell you what treatments in detail are out there. I'm just going to give you the idea how many variety of treatment options you can have. So you can think about the treatment options, or you can tell your friends or family about these lectures to start some appropriate treatment. So there are abortive and preventive treatment for migraine. So abortive treatment is something you have to take at the onset of the migraine to get rid of the migraine within 2 hours. So again, it's not going to be the case when you have everyday migraine, because you cannot take pain medication everyday basis. So the goal I told you about, aborting pain within 2 hours, if it's not doing its job, probably you need the second agent or different agent. So first line, you can get it from over the counter in the Proxin or Aleve, that kind of anti-inflammatory medication, or Tylenol. And then if it's not really doing anything, then you have to get the prescription medication, which includes triptans. It's out there since 1990s. And then it has been out there for entire 30 years, right? It's been 30 years since the 1990s. And there are 7 triptans, and there are oral agent and nasal spray and injectables, a lot of different forms. So a lot of people say, I tried everything. When I go into detail, yeah, I haven't tried everything. So there are so many options. And ergotamine is an older medication than triptans, and we often use the steroid to break the cycle of the migraine. And the purple is a new classes of medication for abortive treatment. So there were actually 8 new medication came out for the past 3 years for migraine treatment. And then they are all new classes. It's not the same class of medication like triptan or ergotamine. It's a total new class of medication. And then out of 8 new medication, there are 9 new medications, because the one medication can be given for acute treatment, and then preventive treatment is certainly approved. So there are CGRP blockers as an abortive treatment, Nurtec and Rally, and then there is Ditan, Rayval. So Ditan is a class of the medication, and the Rayval is the name of the medication. That's similar to triptan, but it's more centrally working in the brain. And then triptan often causes more tightness of neck, and then it has a vasoconstriction property, but the Rayval does not have that vasoconstriction property. So it's actually really good news for somebody who's responding really well to triptans, but they have history of cardiovascular disease or blood clots, then they can switch that medication to Ditans. And the preventive treatment, not everyone needs preventive treatment, but if you have more than 4 migraine days a month and that is debilitating, then probably you are indicated for preventive treatment. So preventive treatment, the goal is to reduce the attack migraine severity and then the frequency or total migraine days by greater than 50% per month. So the classic preventive treatment includes anti-seizure medication, blood pressure medication, and antidepressant. And Botox injection can be done if you still have chronic migraine after trying all these 3 classes or 2 classes of medication. It's just because of the insurance coverage issues. And so Botox injection can be done for cervical dystonia, but also can be done for migraine pattern, and the pattern is a little different. So Botox injection is another preventive, and I'm gonna go over biobehavioral therapy later at the end. And there's a supplement like magnesium, riboflavin, and also seizure blockers with 6 medication now. So it's very exciting for the past 3 years. Out of migraine, there are no area that have 6 medication or no, 9 medications, new medication of new classes for 3 years time period. So there are more options for treatment for migraine now. And there are procedures for migraine treatment. You probably are very used to the procedure, and you probably know some of this procedure. Occipital nerve block, when you have back of the head pain, the nerve block given in the occipital nerve can help significantly for the migraine, especially when it occurs in the back of the head. When I show this picture to the patient, they are like, oh, that looks really great. And I got that today. And so this can be done between Botox actually when you are having flare up, when Botox is wearing off. Botox is given every 12 weeks, but in most cases, the benefits from Botox they don't last up to 12 weeks. So it has a wear off period. So getting the nerve block before the Botox wear off can be really helpful to prevent Botox wear off pain. And trigeminal nerve block can be done if your head pain is mostly on the trigeminal area. And the spinopalatal ganglion block is less invasive. It's not injection, it's actually numbing the spinopalatal ganglion. Ganglion is like a whole bunch of nerve collections, and it's actually collecting. Trigeminal nerve outside of the brain is collecting in the spinopalatal ganglion, and it's going to the brain. So spinopalatal ganglion is kind of an entryway to the brain in center. So we're blocking the entryway, so that reduce the pain signal going to the brain, so decrease the pain. And the supraorbital, supratrochlear nerve block can be done if you have a lot of forehead pain. And the trigger point injection along with other nerve block can be very helpful, because often the neck tension or shoulder tension, the muscle tension put the traction on the occipital nerve, and then it causes a headache. So these procedures can be done with migraine treatment as well. And devices, have you heard about this kind of devices? Neuromodulation device for migraine. The devices that modulate pain pathway that causes migraine are out there. So the medication targets neurotransmitters, and neuromodulation devices target the entire system and nerve cells, we call glial cells, and modulate pain with peripheral access to the central pain pathway. So from the left, there is a Cepali, it's a name. It's now over the counter. It used to be the prescription. It's a trigeminal nerve stimulator. It's FDA approved. All are FDA approved. And the middle one, or second from the left, is the gamma-core. It's a vagus nerve stimulator. And the most recent one is the neuromodulation from the arm. And it's called the RAN device. Nervio is the commercial name, and it's called the RAN device. It's a remote electrical modulation. And the last one is in the drug development. So this non-drug, non-invasive treatment for migraine can be very useful for patients who have a risk of medication overuse, or who have already are on so many medication, and who are sensitive to medication, or pregnant women, or kids. And the good thing about the neuromodulation is there's no limitation, restriction of how many times you can use. So it's not going to cause like medication overuse headache or something like that. And lifestyle modification can't emphasize enough because as Dr. Hogan mentioned, lifestyle changes are a very big factor to the treatment of chronic disease, including migraine and cervical dystonia. So this is pneumatic C's for migraine. It's very popular pneumatic for migraine treatment. And first as in sleep. So I'm going to stress on sleep because Joan is going to talk about more diet. Sleep, the brain is actually 10 times more active when you're sleeping.
I brought it for you.
And the brain is actually acting so much, working so much to get rid of the toxins or unnecessary proteins for the day through the lymphatic system, only when you're sleeping or under anesthesia. So when you're not sleeping well, probably because migraine or pain in the neck, so it's like a vicious cycle. When you're not sleeping very well and waking up every certain hours, the brain starts working and then it'll stop, and then working stop. So your brain never gets really cleared. So you could have foggy brain and then memory loss and blah, blah, blah. So we have to work on the sleep to have really good quality sleep for migraine treatment, and then exercise, eating, regular and healthy, and drinking, stress reduction, all input for the lifestyle modification. So last slide is by behavior therapy. So this is evidence-based migraine treatment, cognitive behavior therapy, which can be done in psychiatry office usually, and relaxation technique can be done with your own apps. There are so many free apps and very good, and then relax your body and the muscle tension, so you can use for both for migraine and cervical dystonia. And biofeedback, it's also given in psychiatry office or pain clinic when it's available. But nowadays there are apps for biofeedback. But some people really don't like biofeedback with the doing biofeedback with the app, but there are biofeedback apps out there too. So this is the end of presentation. What you might ask like a question, like where can I get this treatment? Where can I start? So there are neurologists and nurse practitioners specialized in headache, including me. And if you have more than 4 migraines a month and it impacts your quality of life, it's a good time to seek for the treatment from the headache specialist. And you can get the referral or office to get the treatment options. So we will help you to provide the good information, not from Dr. Google, and it's very common thing right now. Everybody's already know about all the treatment, but some are really educated before they come in, and then that's really help with communication. And we guide you to find triggers and give you the start individualized treatments for you. So encourage you to take control of your migraine before the migraine control you. Thank you so much.
Thank you, Sohita. That was wonderful. So now we're going to hear about another aspect of self-care and why this is a very important part of our whole treatment program, both for dystonia and migraine, or just anybody here in general that has a brain. Hopefully, I'll have a brain. That's a politician or something. So Joan Hogan is a dietitian with Puget Neurology that has been dealing with dietary issues, with brain issues, whether it's dystonia, Parkinson's, and migraine for quite a few years. And so she's going to give you discussion here on sugar.
Hello, I think most of you in this room know me, but I'm Joan. And I've talked about a lot of different subjects over the years in our talks. But one of the areas that, especially for some of you that have seen me on one-to-one basis and in groups, is a lot of people will talk about sugar. And people go, well, sugar makes my dystonia worse, or sugar makes my migraines worse, or I don't feel good when I eat sugar. And I'd like to take a little bit of time, I've got 20 minutes, and go over this in a little detail. I'd like to unpack sugar because it gets a lot of publicity these days. Is it good for you, not good for you, don't you need some? And what are the mechanisms that are happening here? So, okay, so I'm gonna just go over some basic 101 on sugar. This is pretty elementary, but we'll just start there. Sugar. Sugar is kind of a global term for carbohydrate in our diet. We take in carbohydrate in two different forms. We take it in the form of complex carbohydrate, which is from, I like to say our pulses, but for some people it's our beans, our dry cooked beans like beans, lentils. It can be some of what we call our intact grains, our oatmeal, our quinoa, our brown rice, our bran or flaxseed, those kinds of things. They break down slowly in the blood and eventually are broken down into glucose. And then we have refined carbohydrates, which are sugars or our more refined breads, white rice. That is broken down a lot quicker and hits the bloodstream rather quickly. So, but ultimately it all hits the bloodstream. It's broken down into glucose. And at this point, we have a beautiful little process that all of us have, unless we have type 1 diabetes, in which we trigger our pancreas to secrete insulin. It's very simple, and it causes us to store our glucose in the form of glycogen. It's a very readily available storage system in our body. We have glycogen stores in our liver, we have it in our muscle, and it just is a cool little system. It's cool until we eat too much of it, okay? Our glycogen stores will only hold so much glycogen being made in our liver and also in our muscle. And any excess after that goes into storage mode. Not only does it go into storage mode at this point, but if we're used to eating a lot of carbs, which we are actually finding is a problem for a lot of people because everything's carb. It's fat-free. It's, you know, eat it. It's just sugar. It's not going to hurt you. And for the longest time, we thought that's the way our body worked. Hey, it's not about carbohydrate. It's not about sugar. Fat's the problem. Well, until we learned more about how our bodies work, and if we eat too much carbohydrate, that our body continues to produce insulin because we're still getting the message. But what ends up happening is it's not going to work quite as effectively. And we call this, it's called a lot of different terms. It's called, ultimately, it can be kind of an insulin resistance. Or another way to put it is some people will call it, it's like our body becomes sort of desensitized. And so the insulin doesn't work as effectively. I like to think about it, maybe a better example might be you turn the music on in your car, right? And you're by yourself, and before you know it, you're cranking up the dial and you're cranking up higher, and you don't even know how loud that music is until you get out of the car and you get back in later and you're like, geez, why don't the music play so loud? And so it's sort of the way our body handles excess glucose in our blood. Our body is going to try very hard to continually try to store that extra glucose. And so what we get is sort of this little pathway here is we start eating too many carbs, our blood sugar rises, and then our insulin in our blood rises, and then our body's trying to do something with it, and so it's starting to store as much as it can, and ultimately it gets most of the glucose into the cells, but not very effectively, and so we end up getting hungry, and then we feel we need more carbohydrate, and we get in this vicious circle, okay? And if this circle continues long enough, this can result in type 2 diabetes. But the thing is, it doesn't necessarily have to be a problem before it ends up being type 2 diabetes. And that's what I want to go into in a little more detail, is we're finding this insulin resistance that we're finding maybe over 50% of us, especially as we age, tend to have a problem with. And it actually can activate an inflammatory process. And that's one of the mechanisms I'm thinking maybe some people are experiencing when they say, I just can't handle a lot of sugar. Well, do you have an underlying insulin resistance going on that is part of the problem? And we know inflammation can be a factor in dystonia. We know it can be a factor in migraines. And so this is one place to start. Now, I will interject here. Sometimes people just have a sensitivity to sugar. I do food sensitivity testing with people, and sometimes people just will find out from the testing that people truly do have a direct sensitivity to certain types of sugar, whether it's honey or cane sugar, that kind of thing. But what I'm talking about here is the whole mechanism if we get into a high carbohydrate load. The other thing, and this isn't necessarily a brain issue, but we're actually thinking this is insulin resistance might be part of the problem with heart disease and high cholesterol levels, high triglyceride levels. And it used to be, we used to always say, well, you know, if you go fat-free or go fat, that's what you have to worry about if you have a high cholesterol level. But we're actually finding with this chronic intake of people eating all of this carb and our bodies getting into that cycle of insulin resistance, that the insulin itself might be part of the problem. Cancer, again, it's a little far-fetched out there, but we are starting to wonder about insulin resistance, not just glucose. You know, people think sugar is the problem, and yes, you don't want high blood sugars, but that the insulin itself could maybe be part of the problem. But then we move back into the issues related to our brain, and there's more coming out about the role of insulin resistance affecting our memory. It's now being thought as we age, and especially for those of us, including me, over the age of 60, our bodies naturally become a little more desensitized to insulin or insulin resistant. So what that means is that maybe your body, when you're younger, your body just uses more carb. It's your body's growing, it's moving, it's doing things. But as we age, we're finding maybe the brain doesn't handle carbohydrate broken down into glucose, into the blood as effectively. When we look at the brain of people with Alzheimer's, we actually find an element of insulin resistance or high glucose. But the glucose doesn't get into the blood as effectively, or into the brain, I'm sorry, into the cells as effectively. And that's being argued what came first, the insulin resistance, glucose intolerance, or did our diet kind of bring them on? So it's still kind of being debated. But again, neurological disorders in general, it may be something for you to explore with regard to your own symptoms, whether it's migraines or dystonia. And then, of course, we know ultimately that insulin resistance in this vicious cycle can actually result in type 2 diabetes. But I guess the message I want to get across is that there's a lot of stuff kind of happening before that. And you can kind of look at that just by knowing some of your numbers. I think most of you go to the doctor, they do your standard metabolic panel. And one of the normal ones that they look at is just your fasting blood sugar. A normal fasting blood sugar is 70 to 100, and that's in a fasting state. And pre-diabetes can be 100 to 120, and doctors are getting a little more aggressive about blood sugars that are even over 100. Some of them are actually starting to treat because they understand this connection. There's some research that's coming out there, though, that maybe even 100 is too high. And maybe you should be shooting for a blood sugar of 90 or less. So this is kind of in the works. And of course, the other thing that you might be thinking, and I think about too, is maybe when you go in to have your blood sugar taken, even though you were fasting, maybe you went to a birthday party the night before. Maybe it's your grandson's birthday party, you had a piece of cake, and you might think, well, I had cake, so that doesn't matter, that doesn't count. My blood sugar's so high. That was a rare situation. So that's when your A1C can be a little more sensitive to how your blood sugar is running over a period of time. Your A1C sort of measures, an easy way to explain it is how much glucose is attaching to certain proteins in your blood. And depending how much attachment it is, you get a number. And the number ideally should be below 5.8. But there's even some question whether or not that's too high. Especially for our overall health. And last but not least, sometimes people have these numbers in the normal range, and you can have your insulin levels checked. Now, providers aren't as quick to check insulin levels, so, excuse me, you might have to, ask them and push it a little bit, but that also can give you a little more information on how your body is processing carbohydrates and whether or not you need to look at that in your self-care, not just for your immediate self-care and pain, but maybe for your long-term care and protecting your brain. This is a slide from Dr. Perlmutter, and it's a study back in 2005 where they were looking at A1C levels in the impact on brain shrinkage. And as you can see here, there seemed to be a huge benefit even getting the A1C below 5.2. So these are just some numbers to kind of work off and to check yourself. This study also came out looking at normal blood glucose associated with a decrease in brain volume and cognitive function for people over the age of 60. So again, our normal is sort of evolving in this area, and it might be something where you might even want to consider keeping the numbers on the lower end of the normal range. So the question is kind of what do you do about it? What are some measurable things you can do now? So let's go back to these glycogen stores, and so I can kind of give you a little visual of some things you can think about. Now, keep in mind, I talked about glycogen stores in your liver and muscle. Your liver are the glycogen stores we use kind of the most readily. Muscle glycogen stores are the ones that you use more for exercise. So we've heard about people, oh, I'm gonna load my glycogen stores for my run or something, and that's good. And you want those stores good because you want to be able to release them during exercise. But there's a lot of us out there, and there's hopefully not too many of us in this category, that maybe be a little more sedentary. And so it's estimated that in those immediate glycogen stores, we store an average 100 to 300 grams of carbohydrate. And I'd say 100 if you're a little on the smaller side, and 300 if you're a little bigger. And I just want to give you kind of some visuals of how quickly you can kind of fill up those glycogen stores and maybe not even realize where that glycogen is or where that glucose is coming from. So a couple things I like to throw out is maybe like one soda a day, you know, there's 40 grams. Or maybe you're not a soda drinker, you're going to be a little healthier and you're going to have juice. Well, even a cup of juice has 30 grams. Maybe you like cereal in the morning and maybe you like sweetened cereal, and that's about 50 grams. And probably, if it's not sweetened and you put a little sugar on it, probably be more like 30. Maybe you like a healthy blueberry muffin in the morning, right? Because blueberries are good for it. That's good for your brain. But do you consider the sugar that is in that blueberry muffin? So just roughly 50 grams, unless you get one from Costco, and you could probably double that amount. I like to use zucchini bread, for example, because again, zucchini bread is very healthy for you, right? But if you ever make zucchini bread and you see how much sugar you put into that zucchini bread, you're about up to your soda as far as the amount of sugar that you just or glycogen, glucose that you've added to your glycogen stores. And then I always like to throw in Skittles. If you ever see any of my other talks, I always throw in Skittles because Skittles is an example to me of deceptive labeling. If you look at a bag of Skittles, it's gluten-free, it's fat-free, and it's vegan, right? And those are all super healthy things that we all should be considering. But it's 40 grams of glucose that you're going to be taking in. So you have to be really careful when you read labels. Oh, and Skittles are fat-free. I can't remember if I said that, but you know, our labeling of food is just so deceptive. You have to keep in mind that the food industry does not have your health in mind, okay? They just want to sell things to you. And so when you look at your labels, you have to be pretty critical of what really is in this food, if it's fat-free, vegan, and gluten-free. What actually are you still eating that's of value to you? And of course, with my food sensitivity testing, I would be even going into the coloring of those Skittles, because I know colorings can be a huge migraine trigger to some people. Bread, just your plain old bread, 2 slices, you know, roughly 40 grams, but let's say you have a couple of slices of bread for breakfast and you have 2 slices on your sandwich at lunch. Okay, we're up to 80 grams of carb. And maybe in the evening, you're going to go out and have a healthy dinner, teriyaki, it's vegetables, all these good things. But an average teriyaki dinner can be 80 grams of glucose, or grams of carbohydrate. So I just want to kind of give you a visual of how easy it is to add those foods in. So what do you do about it? You know, just some easy kind of unpacking you can do is just try to limit the refined carbohydrates, because of course that's where you're going to get most of your carbohydrate. So that's where, you know, we always say avoid refined carbohydrates, because it's just easier to get more of those and to use more complex carbohydrates. You can have a whole cup of vegetables for less than 5 grams of carbohydrate, okay? And then you get into the fiber component of some of these foods, and that further lowers the carbohydrates you're actually going to absorb. And then I also throw in here avoiding high fatty foods, and you're going to know really what you're talking about. But sometimes when you combine high fat and high carbohydrate foods together, for example, French fries would be a good example, or again, some sort of tempeh kind of situation where you get kind of a deep fried vegetable or that kind of thing. The two together can actually stimulate more insulin production in that kind of situation. So going back to our example of carbohydrate, just some things you can think about when you're starting to look at, well, how does this apply to me and how can I change my diet? You know, we can take that cup of juice. There's 40 grams and instead have a piece of fruit, you know, quite a big difference there in your carbohydrate. Instead of having that big blueberry muffin, you could make your own. It has lower sugar in it, or you could have maybe a real nutty, grainy toast with peanut butter on it. Instead of your soda, just have water, you know, or have carbonated water. And of course, a question I did ask here, well, how about diet soda? Wouldn't that be okay? There's no sugar in diet soda. And that's a very interesting question, because there was a study released in 2014 that, because this had been bantered back and forth, how bad is diet soda? And it's interesting because what they're actually finding now, and they did this study, is that you actually still stimulate an insulin release when you have diet beverages. So if you go back to that little guideline I showed you where you stimulate insulin, it stimulates hunger, and you want to eat more, you're kind of still keeping the vicious cycle going. So I strongly recommend no soda, okay? So just going down the line here, instead of maybe some sweets in the afternoon, you might go on in the afternoon, I gotta have some sugar. Try something that's a little lower in carbohydrate, maybe a handful of nuts. Maybe instead of white rice, which tends to raise glucose levels rather quickly, you could go to cauliflower rice, or even brown rice. Including more fiber. Again, these also slow down glucose absorption, can actually decrease the net amount of carbohydrate that your body absorbs. A couple other things people sometimes say, well, I'll just go ketogenic, and that would be the way to go. And you know, there are these diets out there that are ketogenic. They're not sustainable, for one thing. I find people often rebound from them in a way that they tend to overdo a lot of carbohydrate. So, you know, you start slowly with these kind of changes, because if your body's used to all this sugar and you all of a sudden go down to no carbohydrate, your body often doesn't like it. And you're going to be hungry and cranky, and that can make migraines. That can make your symptoms of dystonia worse also. Try to limit snacking. We also, as Americans, we eat all the time. That stimulates constant insulin production, and again, can activate more of an inflammatory process. So try to get your body so you don't eat as much snack. slowly we try to change that. Sometimes we find time-restricted eating can be a benefit. What that means is sort of intermittent fasting. Other things too that can impact our blood sugar in this whole cycle, and these have been addressed before, so I won't focus too much on them. And the main thing I want to say here is with the exercise, if we exercise, we're going to release more glucose from storage and even our muscle storage. So that's a way to get your body so you can tolerate the carbohydrate a little better, not raise your insulin levels as much. Certain supplements can help with blood sugar management, and these are a number of them: alpha-lipoic acid, magnesium, D, green tea, matcha tea, lots of cool things about matcha. Olive leaf, cinnamon, berberine. Berberine kind of acts like metformin, believe it or not. And actually, if you have to take any medication at all for diabetes, metformin has been found not to be as horrible as we once thought. Actually, anti-aging groups are seeing there's actually some benefit to metformin. So it's not horrible, but a more natural way to try that is with berberine. So that can be something to consider. But it's also something you can take even if you don't have type 2 diabetes, if you just are running a little higher blood sugar. And I'll just close on this. This doesn't have too much to do with nutrition, but I like the slide, so I just want to show it. It's kind of part of what we're trying to accomplish today in our overall health protocol of getting sunlight, trying to get a sauna, even enjoying getting cold in some way or form, grounding, intermittent fasting, sleep, nature, exercise, breath work, and meditation. It's all about what we're trying to accomplish today and our overall comprehensive health. Thank you.
It was so great. You know, this is messages that we should all take for the rest of our lives, and just what we just heard. That was great. So now we are going to get a little chance to move a little bit. And what is the best medicine that exists for almost everything we do? Is just a second. All right. If people need coffee or water or something to So next we're going to hear from a visit from Patrick Forth, actually in New York. He's going to give us some opportunity to stand up a little bit if you have to. You can give some stretching, some exercises. But this is a moment to say about the whole concept of exercise. We just heard how important exercise is just to mobilize your glucose levels, your glycogen levels. So how important it is for your stress and depression levels. How important it is for just for our dystonia control. It's just about everything we do in some ways can be helped by exercise. And we always think of exercise being related to the brain, to the muscles, but we're really focused today on the effect of exercise on your brain. And the whole concept of activating BDNF, that brain-derived neurotrophic factor, that major chemical in our bodies that is promotes brain health and neuroplasticity. So but we have to do it, just like any medicine, we have to do it as like we're taking some medicine every day. We have to do it on a regular basis in order to make a difference in your life. So we need exercise that puts an adequate challenge to the brain. Again, that's so individual for each individual person. Something that's challenging for one person, this could be too much for, maybe not enough for another person, or be too much for another person. So we've had to find the level of exercise that you need, but the idea is consistency and something that has some challenge to your brain. And so we want to do something that has some challenge, which means, things like dance or yoga, or or what we hear about from Patrick next is aligned movement. So we're going to hear from him. For those that are on we have this in your handout, but those on Zoom, he has a lot of really free blogs, and he has good classes that you can connect to with his website, Align Movement, that we can benefit everyone. So let me pick this up for you. Welcome him to the show. So, figuring that I want to explore some ways to help alleviate tension and pain. It's a common place for a lot of people to experience that symptoms. Are you hearing this? So, no, I'm going to stretching and also. Mark, for some reason we're not getting the volume to the computer. Should be on.
Worked perfect last night.
Yeah.
It's right there.
Yes, good. Great job.
There could be a system volume that's not up. I don't really know macro. Just your. Yeah. So the app has its own value. Its own. It's like it's turned up.
So let's just start with a real simple, easy stretch of just letting your.
Let's say hi to him again.
I'm trying to see how this is coming through.
Miles check.
So today I want to explore some ways to help alleviate tension and pain in the neck, which is commonplace for a lot of people to experience a lot of symptoms. And so we're going to go through some stretches and also look at some principles of alignment. So let's just start with a real simple, easy stretch of just letting your head hang down. If you want to play along and do this with me, that'd be great. And you might then allow your head to tilt to one side. And allow your head to tilt to the other side. And bring your head up. How about a turn, just a gentle twist? Can you turn your head to the right? And then turn your head to the left. And then bring your head forward. And see how you feel. And then we're going to look at how we bring our head back up. So let's let our head fall forward again. This is just a great stretch for the back of the neck, if anything, because we tend, as we'll see, we tend to hold a lot of tension in the back of the neck. So now, let's just bring our head back up and look forward. And here's the game, or the awareness to build, is to notice how you bring your head back up. And so how you do something matters. It's not just the endpoint that we're going for. It's really what parts of us are actually moving. So I'm going to demonstrate a couple tendencies. And one is to rotate the head, the very top of the neck, at the top of the neck, and just rotate the head to bring the face forward. But what you might notice is that my neck actually stays in front of the shoulders, kind of like out here if I exaggerate. And this happens a lot for people. It's because it's an easier joint to move is to rotate the head backwards in order to look forward. But the weight of the head, if the weight of the head is out in front of the torso, it's actually a lot more weight that the neck muscles have to carry, rather than what is more desired is to get that head more directly over the torso and align the skeleton more vertically. So I want to introduce a really good principle and exercise called head ramping. And if you want to think about, like if you were to walk up a ramp, you're going in two directions. You're going up, but you're also going horizontally. And we want both of those things to happen. So it's a little bit of a diagonal. And in head ramping, instead of lifting the face or the chin to look forward, you want to play with lifting or thinking of the top of the head as lifting towards the ceiling, as the neck itself actually is sliding backwards. And see if you can play with that a couple of times. You can allow the head to fall forward and relax, which is a nice way to help relax the back of the neck muscles. And then again, rather than rotating your head backwards to look forward, elevate the top of the head. This puts some nice traction in the upper spine. As the neck itself, you can even think way down here towards the base of the neck is what's pulling backwards. You might find instead of the chin lifting, it's actually going closer to the throat. And you don't want to push it so much that you're cutting off your airflow going, but you want to just find where those muscles stop, because the muscles may have adapted over a lot of time, a lot of repetition to this sort of contracting in the back position and neck thrusting forward. So they might not actually have the length, the muscles might not have the length to actually get completely vertical over the torso yet. But if you keep working with that over time, you're going to alleviate some of the weight that the body has to carry, like with the head in front of the shoulders, it's a lot heavier than if it's stacked vertically. And you're going to be able to stretch out these muscles a lot. That's one of the quintessential neck stretches that I like to present. But here's the key, is we can do a lot of stretching, exercise, physical therapy, massage, whatnot, to offset, and to alleviate any sort of tension, pain, or injury that we have in the body. But if we keep going around and we keep doing the things that cause the harm, we're always going to be in this sort of losing battle. Funny analogy is that like if you were to take a hammer and like hit your hand with a hammer and you injure your hand, you can go to the doctor and you might have to set it in a cast or something. And then over time, the hand's going to heal and you're going to get some physical therapy exercises to work your hand out and get it stronger again. But then if you go and hit it with a hammer once more, you're offsetting all of the benefit that you're getting. And oftentimes we want to think about the cause of our discomfort or our tension and pain as something that we really need to address before the exercises we do and the physical therapy we do are really going to take effect. So in that, this is where alignment matters. Alignment is not just trying to set yourself in a posture. It's more about understanding the relationship of all the parts of your body and the relationship between your body and its environment. And so one thing to look at is what environments do we put our bodies in? And very, very common one is a chair. A chair is an environment that induces a particular shape of the body. This tends to be a posture that we all sit in because our chairs kind of encourage this. There's something about how the seat of the chair kind of pushes slightly up on our thighs, tilts our pelvis back, and encourages us to relax into the back of the chair, which is fine unless it's where we place our body most of the time. Because what happens is your body is always sensing its environment and trying to adapt to its environment. And your body really adapts to what you do most often. So if this is the position or something like it that I'm in most of the time, my body's it's sort of solidified in this position. And so, that's why a lot of people say, then sit upright, have good posture. The problem is how we get to that good posture matters. So if I were to try to come up to sit upright from here, there's a lot of different ways to get there. And let's look at actually what's going on with the spine in this shape. So let's say my spine or my whole body starts to get more or less stuck in this shape. I'm going to come up to sit, and then I'm going to adjust other things. Maybe I, lift the chest, pull the shoulders back, whatnot. But those might be ways to mask some of the tensions that are still being held there. So if I am sitting back like this, and what if my spine didn't change from the shape and I just kind of sat upright, I'd be more like this? Or if I came to stand from here, and what if my hip flexors didn't even want to extend as much because they've been flexed for so long? I'm going to end up more or less in kind of a position like this. So that might be the stickiness of the body that doesn't want to fully waken up. And that's putting the head way out in front of the body in a way that is creating a lot of tension in the neck. So some of the common ways to adapt from that or to adjust from that is to do things like push the hips forward. So now I get my head over to the hips. I haven't really straightened out that curve in the upper spine, and my neck is still in relationship to my chest, is still way out in front. It's just tilted backwards. Or other ways might be to lift the chest itself, or other such things of that nature. So I bring that up because we're looking at the relationships. So if let's say these two blocks are, let's say the bottom block is your torso and the top block is your head. And the most optimal way to align everything is to have it vertically stacked. Back in the chair, when you're leaning back, the head tends to come a little bit forward in front of the torso. So it's a little bit like this. So my head's kind of leaning forward, because if it was back over the torso in the same relationship, I'd be falling backwards. So the head comes forward, and not only does the head tend to reach forward, but it also then starts to slide down a little bit. That's that neck going forward, and it actually collapses a little bit, putting some compression more in the neck. And to correct that, you know, if say you're here, to correct that, a lot of people then try to lift the chest, pull the head back, and they end up doing this. Well, here's an interesting thing. If you look at the angle at the bottom, at the junctions of the blocks here, if I tilt it all back, nothing really changes between the blocks. The top block is still out in front of the bottom block. What we want to learn how to do is, and this is the head ramping, is bring that block back over the torso. So that's a bit of like just recognizing the alignment between the two pieces. So let's take a look at that in both from sitting and standing. If you're back in the chair, one of the best things you can do is just simply come off the back of the chair. The seat of the chair tends to push our thighs up a little bit, so we might tend to fall backwards. So it's a good idea also to develop the habit of sitting towards the edge of the chair whenever you can. It's not that you can't ever relax into the chair, it's just we want to do more of the opposite of where we're actually engaging our core, using our torso to encourage the body to create a different shape. Then, rather than going straight to pulling the head back, find the relationship from the bottom of the torso up. So the pelvis, we want to center the pelvis and get it out of that tucked rounded position where the butt's tucked underneath you. And see if you can start to rock that pelvis a little forward and back. And even find the neutral sway of the lower back by the tilt of the pelvis. Now, this is where people sometimes get mixed up, because if the pelvis wants to tuck all the time, people try to recreate the sway of the back by, once again, lifting that chest. But what that is sort of doing is it's creating the sway from a different place in the spine. It's higher up in the spine. And that lifting of the chest is actually just rotating the whole rib cage backwards. And if, say, if the vertebra are vertically stacked, it's not just finding it vertical or even in a little bit of extension. It might actually be a little bit of shear, where you're pushing one vertebra in front of the other, which is another place where you create, some strain and tension and instability. So think about trying to create the sway of the lower back by just rocking the pelvis forward. See if you can find almost like your butt is slightly behind you. You should feel like you're on those sits bones at the bottom of your pelvis, the ischial-tuberosities. Then, once the pelvis is centered, then find your bottom ribs. And if you can feel the ribs at the bottom front of the belly, or at the top of the belly, the bottom front of the rib cage. If you can feel underneath them, it's a real good indication that your rib cage is actually rotated backwards a bit. We want to see if we can center these ribs so that those front ribs drop down and back into the belly. Another thing we're looking for is the sternum to be pretty much vertical. Now, what this will do, though, is it will really illuminate how much excessive curve we have in this upper spine and how habitually our head is forward in front of the chest. That's okay, because now we can work on this once our foundation is set. So ribs are down, pelvis is neutral, and then you can go into your head ramping position. So I'm going to put my hands on my chest because we want to look at this too. Ramp the head, pulling the chin back, or rather, let's pull the neck back, top of the head towards the ceiling, until the muscles kind of feel that pull. And relax. Pull it back. And see if you can do that without lifting the chest up. So that is creating a different relationship. And it's a better way to find a seated posture to keep encouraging more of a vertically stacked skeleton. Let's look at that from standing. So if you come up to stand, oftentimes when we're seated, we're not really using our hip muscles very much. I mean, they don't have to be used. But when we come to stand, sometimes they still are going, oh, I don't know really how to hold the body upright. And one of the things that really predominantly tends to happen is then our hips, we wear our hips, if you will, in a place that might actually create more tension in the neck. So when you stand, notice where is the weight over your feet. You can just play with this a bit, rocking a little bit forward to your toes, then back to your heels. Toes to heels. So I'm going to exaggerate a bit, but if your hips tend to push forward, we have to counterbalance some way, because if our body was really just straight and stacked vertically, we would end up falling forward. So it's a natural tendency to counterbalance by doing things by, again, lifting the ribs, tilting the head back, or maybe the ribs lift, but the head stays forward. Or, I mean, there's lots of variations. Maybe the hips fall forward and we bend the knees and tuck the tail. Or, you know, some people go the opposite way, if the hip flexors really tight, or something might be a bend the knee and hinge here, and then tilt back into the rib cage and trying to get the head on the shoulders. All these are distortions of this vertical line. So, and that inevitably puts some more tension and strain in the neck. So find your stance where you're standing up with feet about parallel, hip width apart. And then just simply see if you can shift your hips back until these hip bones, the joint of the hips here, are over your ankles. You can even just think over, put more weight onto the heels. You may feel like, whoa, I'm gonna fall backwards. But that's just the posterior chain, the butt muscles and the back of the leg muscles trying to figure out how to hold you upright. They might not be accustomed to working so hard. And we need to get them stronger. So see if you can get your weight back over your heels, keep your legs straight. And then just as we did while seated, pelvis is neutral. We want this vertical in the front, a little bit of a swing in the back there. So your butt's not tucked under. Ribs, let them sink down. Let this sternum be vertical. Then if that has eliminated some of that hyperkyphosis and neck thrusting, play with ramping the head. I'm going to hold my chest down so it doesn't move with me. And I'm going to pull gently the back of the neck backwards, top of the head towards the ceiling, and find that traction. And then you can, this is something you can play with all day long, is just gently, just notice where you are. Where's your body weight? How are you carrying your body? And then just make little adjustments, little shift. Weight back to the heels, ribs down, head ramping. One of the reasons that we tend to fall out of more of a neutral alignment is not only chairs, but also the design of our shoes. And very often, I'm going to use a little half cylinder here, is our heels in our shoes are most of the time higher than our toes. and we don't really think that's much of an issue because it's so common, but if we were trying to find neutral vertical alignment, by lifting the heels, what we're really doing is tilting the whole body forward as if we were walking downhill all day long. And if you ever walk downhill, you might find that you have to do things like bend your knees and kind of lean back a little bit to kind of keep your body vertical with gravity. And in a sense, they say that every degree of lift of the heel corresponds with a degree change of the joints all the way up the body. And which, you know, is just not a good way to chronically hold the body all the time. So my suggestion is to get yourself out of that environment followed by lifted heel in the shoe and try to find a flat sole. So come back down to sit. And let's look at that little bit of a stretch in the neck one more time. Not only how we hold our body is from the legs upward is affecting the neck, but also even how we hold our arms. We spend a lot of our lives in kind of this position, whether this is typing, this is our phone texting, this is even forks and knives, eating at the dinner table, driving in cars, reading books. We have what they would say an internal rotation of the upper arm, and sort of a turn down of the palm or a pronation of the forearm and wrist. This position, it's not a bad position in itself, but held all the time, it's shortening the front of the shoulders and chest muscles a bit. And it does cause, does have a tendency to allow the neck to fall forward again, which again, puts more strain in the back of the neck. So it's wise for us to try to offset that as much as we can, to try to find reasons to, and even just stretches of externally rotating the arm and supinating or turning the palms upward. So just do this for a moment. Try to rotate those hands out and in from the shoulder. This is one example of just rotating that shoulder blade. And then bring the hands out and extend to the arm and reach out. Now notice if you feel any pull up here, or are you just reaching from the wrist? So another one way to tune into it is bend those elbows. Let the shoulders come in towards your center, towards the spine, and then try to pull your shoulder blades apart. In other words, reach your elbows away from your body. Try to engage from the upper arm. That should put some nice traction and pull through all the muscles that connect the arm into the torso, the chest, the back, the neck. Then let the arms extend and play with a little more rotation here. See if you can turn your thumbs backwards and down, palms are up, and try to get your elbow points to even rotate a little bit forward. Side positions like this. Notice if your chest wants to lift, keep it down. Reach away. And then let it relax. Now, can we do that while ramping the head? We're going to pull the head back and up and reach those arms away, rotate the arms, and then go ahead and tilt your head to one side and reach with that opposite arm. If you want to let one arm hang down, you can. Can you feel that pull to the neck? And then go the other way. Reaching with the arm, head ramping back, and pull. Notice if there's any difference between if the head is out in front of you or ramped back as you stretch the arm. You can always move the head, you can move the arm in different positions. It's a nice place to explore. Okay, let's let that go. So there's a lot of explanation, a couple simple exercises, but really we want to look at the habitat that we're in, what is the environment we're putting our body in, and our habits, what are the habits of holding our body in order to offset the causes of some of the tension. And by being aware of the relationship of our different parts, we just have more knowledge and power to benefit the body. All right, have a great day. See you soon.
Well, that's another thing that each one of us, the message each one of us could bring to us for our lives again, that we can really take away from this whole program. So again, I really encourage everyone, you took on your handout, to go into the website, those on Zoom, it's in the line movement, just connect with his newsletter each month, and get a lot of good lifestyle tips, and he has building in the comfort of your home to do Zoom classes at your own leisure, online, or else even in person, or even in one-on-one, you can arrange it. So there's so much to learn from this as far as getting our body into alignment. So it's the whole concept of finding your right exercise that you can do on a daily basis. So now what we've been all been waiting for is our keynote speaker. People probably need much introduction to Tom, since you see him on he's in my office. He sees his books on my desk every day, and he's of course someone that has suffered a great deal with dystonia, as you'll hear, and has written about it, but has found a way to cope and to manage the challenges of dystonia. So let's welcome Tom.
Thank you very much. I appreciate the introduction. Going on what Patrick was just saying about how we use our bodies, one of the things that I was concerned about was the microphone I'd be using. Because if I'm going to be up there for about an hour, how many of you talk on the phone holding it to your ear and have tension and pain in your neck and your shoulder and your back? If you do, I encourage you to use a headset or go on speakerphone and have it on a support in front of you. So that being said, I'm going to try and actually have it on the podium so I can actually move around and have freedom without having to hold the microphone up and cause the tension in my neck. After a while, I do get that pain and fatigue, as you all probably can relate to. So is there a way we can adjust this possibly to have this up?
Yeah, let's try it.
Yeah. That makes sense that people experience that with phones and other. Okay. Can you hear me okay? Awesome. All right. I have so many slides here I put together, and I have about an hour, so I'm going to fly through some of these. So if you need me to slow down, please just raise your hand or just shout out, and I'll slow down. I also encourage you to take pictures of any slides you see, and I can go back to them. You could contact me any other time to go through them. Also, before I begin, I have a couple devices here that you may be familiar with, and I may use this from time to time as I'm talking. This is called a shepherd's crook, and this is called a theracane. And there's other similar devices. There's another one that's called a back buddy. And these are trigger point tool devices. And if you're unfamiliar with them, they're designed for getting into certain muscles in your back that you can't reach with your hand with some of those handheld trigger point tools. So you can actually put pressure, I'm just gonna back away, in different areas. Now, for me, what that does is it reduces the muscle tension and the pulling that I begin to have one way or the other. And sometimes I'll even have it just hanging over my shoulder as a sensory trick, which we'll be going over, the sensory tricks. I mean, anybody here use sensory tricks, holding your face and that kind of thing? Yeah, for me, it's just dropping. For me, this, I think it's right here. best one. So I may just kind of stand here with this and use it from time to time. This one's great if you travel because you can take it apart and come in 2 pieces. So this is available on Amazon. It's called a Thera cane. So I just wanted to show you that before I begin. So I'm going to talk about the management daily challenges of Dystonia. Going the wrong way. Okay. Anyway, just to begin off, I traveled a very, very long way to be here. I am from Wilmington, North Carolina. If you're unfamiliar with it, if you are familiar with the Weather Channel and hurricanes, we're often on the news. We are one of the bullseye areas along the East Coast. So we traveled about 3,000 miles to get here. And I say we because it was my girlfriend and I, Elaine, who was in the back of the room there. Elaine, she and I came out on Wednesday. We've not been on vacation for more than a weekend in over 20 years. I think I've been on, the last time I was on vacation was like 1997. So when I heard I was coming out here, I thought, let me come out a couple days early and leave a couple days late. So we've had a phenomenal time and it's beautiful out here. So very long trip, but so happy to be here. Traveled a long way, not just in miles, but also living with my dystonia. And I'm going to go through some photographs of the history of what I've been through and where I am now and what got me here. As you can see, a progression of pictures here. There's clearly a difference over the years, in the past 20 years that I've had this condition. Now, the bottom right picture is relatively similar to how I am right now. And as we all know, photographs don't tell the whole story. You don't see pain, you don't see the turning all the time, you don't see the tremors, you don't see the fatigue, you don't see the emotions that we experience. So when you're looking at someone's photograph, there's more to the story than just what you see. So just be careful sometimes when you look at them. There's more to it than what meets the eye oftentimes. So I still deal with all of these symptoms, just not as severe as they used to be. So my topics for today, I'm going to talk about my personal journey, the general life impact of dystonia and pain, emotional and physical, and then how it impacts my life, the things that help me the most, stress and emotions in the role they play because of the mind-body connection, how important that is, and then if we have time, hopefully some self-care strategies. So this is how dystonia physically manifested in my life. And you can see the increased muscle tone in my neck on the left side. When I moved, it actually pulled even further toward my right shoulder. And on the left side, when I used to wake up in the morning, I used to have full upper body spasticity where it was hard to even move. And I'll show you the next photograph here. On the right, I was merely trying to peel a banana and make a smoothie for breakfast. And I was having to move like this because not only was it the neck, it was all the way down and it was turning my entire body. So I was, just to peel a banana was brutal. That was, once I finished that, I was done for the day. That was basically my day. That's how severe it was. The picture on the left, I was kind of feeling like I was having a good day. So I asked my mom and my dad, I forget who it was, to take a picture of me. And I was shocked to see how high my shoulder was on the right side compared to my left side. And that's not something that's uncommon for a lot of us. And that's because of the shortening of the muscles that are pulling us down. Now, if I were to pull that shoulder down, my head wouldn't have gone down much further. So this kind of compensates and protects the neck. So that's another manifestation of my dystonia. I want to back up a little bit further because there was a time just before 2001 when I developed my symptoms. I was incredibly active with sports, with traveling, with business, with you name it. I was go, go, go like many of us were and want to be still, but we're not able to be. I was almost a professional athlete in baseball, golf, and football. Not because of dystonia, but I had the ability to be at that level if I decided to pursue it. But I wasn't able to just, well, I didn't pursue it as a thing, but point being is that I went from that to this person here. So you can imagine the life change that took place. And as a result of that, and back then, like many of us, we take so much for granted. We don't realize the freedom that health brings us. So gratitude is a very important thing to have, even when you're suffering with something like dystonia or anything else in life. Be grateful and focus on the things you can do, not what you can't do, as much as you possibly can. And I'll get into that a bit more. So my symptoms, they first began with a very slight kind of tightness and restricted movement back in 2001. And I noticed a very slight head tilt. I actually went from graduating college in '94, went in private business for 6 years, and wanted to go back to graduate school for a master's degree in counseling. And it was during that time I was noticing some tightness in my neck and just a very slight head tilt. And I recall getting the identification card for college, for school. And I walked away and I could see this head tilt that was much more pronounced than I was used to. And it was kind of deflating. I thought I was actually better, I had a better appearance than it actually was. My initial symptoms though was neck weakness, ironically, because with dystonia, the muscles are contracting and spasming and they're very, very tight. I was noticing a flopping of my head as if I had no muscles strained on my right side. So whenever I walked, my head would flop to the right, and then the next step, it came back up. One down, one up. It's just flopping. That eventually progressed to my head constantly contracting and pulling to the right. And it was eventually stuck in that position. And it was stuck in that position and it would pull with any other kind of movements. So when I moved, it made it worse. After about 4 months, I began to experience pain and the muscle spasms, contractions. I like to call them contractions because, you know, spasms to me is sort of, I don't think in many cases really kind of the word that describes what many of us go through. It's violent, more Charlie horse type contractions that we experience. And you know, people that don't have dystonia, you tell them you have, well, it's involuntary muscle spasms that are caused by yada, yada, yada. And they say, well, I got a spasm in my back and everything. And they're playing golf and they're working and they're doing things. Back spasm compared to contractions are very different. Most of us experience intense contractions. So I like to use the word contraction, but in this program, I'll use spasms, contractions, they're changeable. So by January, so 6 months after my symptoms began, I was bedridden. However, I was really floor ridden because I did not want to stay in bed. I wanted to try and live as much of a life and have as much of a routine as I possibly could. So I made myself get up every day. I made myself try and take a shower at least, do something, and I'd grab breakfast, and I was on the floor, and I was rolling around in pain all day, just trying to find some semblance of comfort. And when I had it in me to get up and on the computer, back then we had dial-up, so it took a while, I finally came across spasmodic torticollis, which is another name for cervical dystonia. And I looked at photographs, looked at the description, I said, that is me. And then I began to tell doctors who I've been seeing for months and months who knew nothing about it. They looked it up and said, oh yeah, that's what you have. Why didn't you know in the first place? So I went through that, and I'm sure many can relate to that. And I'll talk about my medical diagnosis and what I went through in a moment. But at that point, I felt nothing but intense pain. It was like somebody had a drill in my neck, my shoulders, my back, my spine, and a hammer just constantly beating. I know that I'm a little bit nervous now, I'm talking quickly, but there's a little bit of gasping in my breath. But back then, I spoke as if I was being injured over and over and over. So if you think of a time you've been injured, whether it's just stubbing your toe, jamming your finger, hitting your elbow, that where it takes that pain out, that's how it was for me all the time. And this is how I spoke. And I was always trying to just get relief from the pain. And after working through, and I'll share what I've done to get to where I am now, I can speak peacefully and calmly, and I can breathe, and I can be more at ease. But back then, it was super intense. So I've come a long way with regard to all those different things. So my medical path to diagnosis, you can see, I don't need to read all of these. I went through numerous different kinds of doctors, multiple ones in certain disciplines, even neurologists did not know what it was. I had to actually go with the diagnosis of my self-diagnosis to a neurologist who confirmed it. Got an animal? So the general overall life impact that many of us can relate to, this isn't for everybody, but generally for a lot of us, many things are affected. So our relationships, work, social connections, everyday activities, they are all impacted in some way, shape, or form. We deal with a lot of embarrassment sometimes because of our symptoms and how they look at people looking at us, and so that can lead to isolation and anxiety and depression. It can also disrupt our sleep and hinder so many of our activities in general. So we may avoid social situations and we feel uneasy being in public. And we often feel extremely misunderstood. Now, over the years, I've tried to explain to people what I go through. And no one can really even understand exactly how it feels. And I expect nobody to get that. There was a time when I didn't, I was very frustrated. There's no way anyone can really feel what I'm feeling. And I can't feel what any of you are feeling right now either. We can sort of relate, but we don't know exactly how it manifests, how it feels. So what I look for is understanding from people that I have challenges, I have limitations, I have some struggles. No different than everybody in this room and anybody in this world dealing with anything in life. Life is difficult. We all have to be more understanding, even if we don't understand exactly what someone's going through. So that's what I look for from people, and that's what I try and give to people as well. So we also can deal with a lot of shame, anger, and depression. The shame can come from ourselves feeling as though we've done something wrong. It's our fault. Sometimes we see doctors who are not amazing, like this guy right here, and I mean him. He's phenomenal. Okay, we need more people like him. Doctors will blame it on us sometimes. They'll I can get into it for hours, I'm not going to, but we all know that many doctors will not give us the things that we're looking for, and they'll blame us oftentimes. You know, you're dealing with anxiety, you just gotta work out more, you need to exercise, you gotta get out, you gotta socialize more, work a bit more, you know, take a little nap, et cetera, et cetera. You know, it's all in your head. How many times have you heard that? I mean, that can come from, so you have a lot of self-shame and shame that comes from others as well, including non-doctors, just people in our lives. So let's be very careful about how we relate to ourselves and other people. So the impact on my life in particular, so I went back to graduate school, as I mentioned. I had to drop out of grad school, stop working. I was literally rolling around all day on the floor, in pain. I lost all my money and savings. I was in severe debt. And I lost a lot of my friends and my family because they couldn't relate to what I was going through. Nor could I find a way to fit my life back into their lives either, because I couldn't keep up. I tried to, but I just couldn't keep up. And so we kind of drifted apart. So it was very painful to go through all of that. Had to move in with my parents. I was 31 years old and had to move in with them. I was living in this one room. I lived there for 10 years with them before I was able to get myself back together physically and financially and everything else to get back to my own. I developed severe anxiety and depression. I was so uncomfortable leaving the house. I forgot what fresh air smelled like. It was a foreign smell to me. So I was just so completely lost in my world. Ended up gaining 150 pounds. And that was from a very sedentary and self-destructive lifestyle, which I will go through in a moment. How did I cope with all this? Like most of us, I grieved, I cried, I yelled, I retreated from the world. As I was saying, I was isolating myself in my home. I drank a lot of alcohol to medicate the emotional and physical pain. And I had a horrible diet, and I gained, like I said, 150 pounds. I felt like my life was over. I did not care about anything anymore. I lost my will to live. Now, here's a photograph of me as I began to gain weight. And here was my medication of choice, Budweiser. So I kept them in business, or at least I increased their stock. And I'm going to show some more pictures over the next several years of how my body kind of grew. Here I am on my 33rd birthday, actually. This is a party my mom threw for me, and I was just, sorry, Mom, I know you're watching. I was miserable being there. I had to talk to people, be around people, and I was the center of attention. You're dealing with this, as we all know. Center of attention sucks. You don't want to be in the middle of anything. You want to hide in the corner under a rock. So it was very hard for me to be in this situation. This was a year later, Christmas, just before Christmas. And this picture was taken. I wasn't even aware it was being taken. And a month later was my birthday. And this is actually a picture of my nephew and my niece behind me. They came the following month to my house and brought me a birthday card. And on the card was this picture attached to it. And I sat there and stared at it, wondering, why did they give me a picture of them with some guy I do not know? I am not kidding. I did not recognize myself. because back then I didn't have photographs taken and ran for the camera like many of us do, and I never looked in the mirror, and I did not know that it was me. When it finally hit me, I said, "Am I really that big?" And my niece, God bless her, she said, "Uncle Tom, the camera hits 10 pounds." So to take a line from friends, how many cameras were on me? That's what my next comment is. So, now you'd think that sort of an experience would change my mindset, to change the destructive lifestyle of not just drinking, but I was also eating a horrible, horrible diet. And you think that would change things, but a year later, here's where I was. This is another nephew of mine. Just happened to be right before Christmas again, sitting on my lap. And I'm so large here, you can't really see the muscle contractions and the increased muscle tone like you saw in the other photographs early on. But this is what I became. And I am showing these photographs of this weight gain, and it's not Dystonia related, but in a way it is, because these images are a depiction of what I was feeling on the inside. The absolute misery, and this is what the manifestation of that was, due to the way I was merely trying to get through the day. And I found things to get through the day. They were not the best choices, but it's what got me through the day. But it led to somebody who was put on blood pressure medication, who was a candidate for a stroke or a heart attack at 35 years old. This is not the person who used to work for a health education company, who was a former almost professional athlete. That's how much life changed, and that's how much I could figure out how to find my way in the world and cope day to day. So between 01 and 06, I gained 150 pounds from drinking, eating, an awful diet, and being very sedentary. So while Dystonia wasn't killing me, my lifestyle was, so I had to make a change, but I did not know how. There was a turning point, however, that my body took over. I developed a stomach virus, and for about 2 weeks, I was literally, flash here. So for that 2-week period, I was either in bed or the bathroom, and I couldn't eat, couldn't drink, or I couldn't move much, and I was alone with my thoughts. And I was quite frankly terrified, because I knew that the stomach virus was going to get better. Dystonia I knew might be around for a while, but the stomach virus was going to go away. And when it did, I had a choice to make. And this is what I thought about. Not necessarily the movie itself, but I thought, are you going to keep killing yourself, Tom? Because I knew I was. Or are you going to make a change? And I wanted to make a change, at least make a go of it, and see what I could do to make things better. So what did I do? I stopped drinking alcohol, changed my diet, got rid of all these foods that I have listed here, and completely dedicated myself to being as healthy as I possibly could to see what may come of it. So I replaced those foods with fruits and veggies and meats and eggs and nuts and just fruit and protein smoothies type things. And I walked every day. I didn't walk for my dystonia. A lot of people do it, it's helpful for them, but I walked to try and move. I wanted to get movement into me. I wanted to try and lose that weight. And for my dystonia, I did a very specific exercise, stretching, massage, pain tool, exercise program from the STRC program, which is the Spasmodic Torticollis Recovery Program, which is in New Mexico, that some of you may be familiar with, or maybe have gone to or gotten the program. That was the thing that probably was most helpful for me. Not everybody responds to that, and not everybody responds to a lot of other things that we do, but that was for me one of the main things that helped a lot. So doing those every single day was very, very helpful, and I still do a lot of it, so it's still part of my lifestyle. One thing I also did, which is something that over the years has probably proven to be more helpful than anything at all, is I learned how to calm my mind using meditation, prayer, affirmations, progressive muscle relaxation, visualization, breathing exercises, and a combination of all these things as well. I don't need this on the line. So this is kind of a flash here. So this is, didn't transition on this slide here, but here's what came of all those changes. Now I actually in 2007, I lost all that weight and my neck got significantly straighter and I had less symptoms. I happened to take this picture just because I wanted to do a side-by-side with my nephew, who at his time was in high school. And you can see the transformation that took place. However, if you were to back this up 10 years to 2007, my body and my neck look very much like this. And I'm showing it this way because of being consistent, doing the things that I've been mentioning, and things I will be mentioning, the consistency every single day has helped me to maintain that. And as you can see now, I still have pretty much that same kind of, appearance. I'm still symptomatic, of course, but the appearance I have, I've been able to maintain by being consistent and really dedicating myself to that. So I just wanted to share that side by side. I was actually put on the cover of a weight loss book, which was written by my brother, so it's not a big deal, but kind of cool. But anyone who's interested in weight loss or anything about why it is we eat the way we do, this book goes over how it is in the mind and how the brain works with regard to eating and the foods we select and just lots of really, it's a really quick, easy read. It's like $10 on Amazon for the paperback and 99 cents for the Kindle. So really cool book to check out if you don't have it. So what was the key mindset to the change I've had and the success I've been able to maintain? I had to embrace the suffering. I was running from it. I had to face it in order to embrace it, to erase it. I couldn't keep medicating myself and dealing with it the way that I was. I had to do something called embrace the suck of life. And when I grew up, I wasn't allowed to say the word suck. And so for anyone who I offended by saying that word, because that was as much of a four-letter word in my house as any other word, but I was talking to, I do life coaching, and most of the clients I have are dystonia patients. And I was talking to one client today, and she was resisting a lot of what she was going through. Just out of my mouth came, you have to embrace the suck of life. I've never heard that term before. It just came out, and I went, that's pretty cool, I like that. So I ended up writing an article about it in my new book I have back there. In the Adapting to Adversity chapter, I wrote a whole section about how to embrace the suck of life and what that means. Prior to writing it, though, I thought somebody must have thought this before me. So I want to look and see if anything's been written about this so I don't plagiarize somebody. I looked it up. So some of you might be familiar with the term embrace the suck, which is a military term. And it's used for, when you're dealing with, if you're cleaning the latrines with a toothbrush and you're just saying embrace the suck, you gotta get in there and clean that thing. Or if you're in the middle of Afghanistan or wherever you might be, embrace the suck. You can't run from it. You can't run, you can't hide. You can, but not for only so long. So what does this mean? It means acknowledging that life is hard and it's filled with pitfalls. So I had to acknowledge back then that I was going through one of the darkest storms of my life. That was totally unexpected. It's also not resisting the bad things that happen to us in life. So how do I work through this? One moment at a time, one day at a time. So talking to myself, how can I make the best of the difficult situation? It's also not fighting the things that will only fight back. If we resist the flow of life, life is going to fight back. And so instead, I like to say, what is this teaching me? I try and get to a point of learning when I'm going through difficult time and change my mindset and make that shift, that my focus is taken away from being lost in the suck of it all. So really what this means is that tough times are not to be ignored, denied, covered up, or masked with drugs, alcohol, food, poor relationships, and behavior where we deal with the suck of life, no matter what it is, in an emotionally reactive fashion. You can take a drink. Stop the whole thing. Not sure what I hit here.
Push it again.
What?
There you go.
There you go. Got it. Thank you. So this is a quote from my book. Though despite the challenges we all face, the biggest and most complex obstacle we will ever have to personally overcome is our own mind. We are not, no. Oh boy. I'm not moving. Movement disorder causes movement. You have to do it to get comfortable. Despite the challenges we all face, the biggest and most complex obstacle we'll ever have to personally overcome is our own mind. We are not responsible for everything that happens to us in life, and we are responsible for the self-defeating thinking patterns undesirable experiences might create. Just like we're responsible for all the positive thinking, patterns that can create good things. So I love this picture because life's kind of like a cactus. You want to know how life works? Give me a hug. So what did I embrace early on? Like I shared, food, alcohol, isolation, to try and hide from all the pain. I didn't know back then how to embrace the suck of it all. So I embraced anxiety, depression, and avoidance instead. And I lived the life of a victim. So when I changed my lifestyle, my mindset, this is what happened. This is a transformation, as I've shown you already. And again, here's a pictorial, view of as well over the last 20 years. I have this at the printout where I bring to my doctor's offices to show them what I've been through. Because they look at me now and say, "Oh, I can see Dystonia." And I can point it out and I can show them where it is. But I show them this because of where I experienced pain in my body, so that they can see what maybe certain things over the years have created herniated discs and other types of issues that they have. So if you have something like this, I encourage you to take photographs and videos to bring to your doctor, because the more information they have, the easier it is for them to understand and diagnose what you're going through. So I had to learn to be okay with what I viewed as not okay and then take action. So here are the things that helped me most. Medications that target exercising, stretching, massage program I mentioned before, the ST clinic, muscle strengthening, core work, removing toxicity from my internal, so what I'm putting in my body, and my external environment, being people, environments, and like you were saying before, we're very sensitive to certain things. So for me, I need to be very mindful of when I'm being oversensitized and when and how I can take breaks from all of that. Had to learn to be mindful, like I just mentioned, of overstimulation of my senses, and I had to change my lifestyle to fit the new me. I was trying to fit the old me into the new lifestyle, into the new dynamics of my body and what I could do. And I tried so hard to keep up, and I couldn't. It made things worse. I also like to try and find a balance in movement and rest. Regarding movement, as we were just doing with Patrick in the video, it's very, very helpful, and our bodies are designed to move. And I think movement is one of the best things for a movement disorder, if you can find the right kind of movement for your body. Now, I just want to show this quick video. I walked into my parents' house. I used to live with them. Now I live about 2 miles away in the same town. And I walked in their house one day and I turned the corner and I happened to see this. It's my mom on the floor doing her daily exercises. Okay, she's 85 years old and she still keeps moving. So give me permission to show this, even though she wasn't happy with the angle. Now, during COVID last year, we lived near this beautiful ocean on the river, and my mom and my dad, they took up walking every single morning down by the river. And one day my mom, again, she's 85. One day my mom just said, "I wonder if I can run." And she began to run. Now, no, she wasn't doing a sprint, but she was moving. And so I was leaving their house one day, and I'm backing up, and she's running up to the car. And I tried to get a video of her real quick, and I didn't get it. And I said, "Well, I'm going to run back to the house." So check her out. 85. Nothing, she's not sprinting at all. And I don't know if you can tell in the video, but at the very end, she lifts her fist up in the air like Rocky. And that's my favorite part. But she's 85 years old. Now, not to be undone, here's my dad. I happened to walk her by that room one day. And here he was watching TV. He said, "Let me get up and just grab some weights." Now, unfortunately, I don't think the video's going to work on here. He's actually, it doesn't work. He's actually just doing some movement. So movement of any kind, if you can do it, no matter what it is, even if just moving your finger. Movement is very helpful for so many things. It's very anti-inflammatory activity. It helps to produce serotonin and dopamine, and they help feel good, hormones in the body, endorphins. Get those things flowing as much as you can with anything at all. So what else will help me? So removing a lot of my stress triggers in my life and setting boundaries without allowing guilt or judgment from others to alter my life choices. This is my life to live. You guys have your own life to live. You're not out here to please anybody. Be kind and wonderful and nice, but don't push yourself beyond the level that you can handle physically and emotionally. So set those boundaries and stick to them. Having a good attitude and sense of humor are very helpful as well. And letting go of things that I can no longer do is very helpful. So I had to let go of that athlete that was there. I don't play golf anymore. I don't play baseball or football or tennis or everything. I can, but it's just too tough on my body. I got some things that make it too challenging. I don't really want to overtax myself too much. So I had to stop comparing my life before dystonia to what it was now. So the only comparison I ever do was me at my darkest time in my life to where I am now and the growth that I have made. So every single day, we should just try and be a better version of ourselves that we were the day before. And that's what's really helped me quite a bit. So again, focus on now, what not what once was, and acknowledge every single effort we make and the accomplishments, no matter their size, every single day. So take stock of your day when you go to bed at night. What did I do today? And it may not have been a lot prior to the study, but it doesn't matter. You still got up and you made a life for yourself, no matter what it was. Acknowledge that. Be proud of yourself, and then try and build on that if you can. Helping others is also a very helpful thing. It helps take focus off ourselves, and also helps to increase those feel-good hormones like serotonin and dopamine and all those wonderful things. And also to not look at myself as a victim, but as a student, as I was mentioned before, to learn life lessons. And I've learned more things from Dystonia than I've learned from anything else in my entire life. So this is a great quote I love. So victim status embodies all that I reject about the struggles of life. The challenge is to live and function well under all circumstances, including those never anticipated, like illness. And I don't think anybody in here anticipated what they're living with regarding dystonia and probably many other things in life. So also very helpful is a support system, and everybody's support system, of course, is different. Family is important. If you can have family, that's wonderful, friends and in-person online support groups just like this right here. And if you're not on any online support groups, you're looking for any kind of helpful ones, I know a lot of them, so please ask me and I can set you up with some of those. Those are all extremely helpful. For me as well, the various tools for pain and spasms like the two I showed you. I also use the Theracane Shepherd's Crook back buddy. I have a massage machine, mats, heat packs, ice packs, topical lotions. Nutrition, of course, is very important for me. And also, I schedule rest into my day. I schedule rest, ice, heat, massage into my day as much as I possibly can. Also learning how to do nothing with guilt. A lot of people need to feel as if they got to be out moving and doing and things. I also schedule a period of doing nothing. And I'm not really doing nothing, but I just escape everything. Go to, if I were here, I'd grab a lounge chair, folding lounge chair, and I just go lay in the sun for half an hour, and just relax. Maybe put some music on or some relaxing meditation type thing. Just get away and just do quote unquote nothing. And I find the most peace and creativity and other things actually happening during that period of nothingness. But it's a matter of doing it without guilt, knowing you're doing something good for your body and your mind. Also critical is learning how to deal and manage with your stress and your emotions. And here's why. Intense stress and negative emotions such as anger, shame, fear, frustration, bitterness, resentment, jealousy, etc., they keep us stuck in the fight-flight stress response, also called sympathetic dominance, referring to the sympathetic nervous system, as opposed to the parasympathetic, calming, rest and digest part of the autonomic nervous system. So what happens is it creates an environment in the mind and body where any kind of healing is near impossible. So the reason why is because the body is constantly pumping out pro-inflammatory chemistry. We hear pro-inflammatory a lot, primarily as it relates to food, nutrition. But the same chemical, the same pro-inflammatory chemicals being produced from eating poor diets and having a poor lifestyle is the same chemistry is being produced when we're dealing with anger, depression, anxiety, etc. It's the same exact chemistry, it's no different. So we need to really be mindful of this because without dealing with these emotions, the body is not able to heal. It's impossible. It's physiologically impossible. So when we choose to come to terms with the reality of our lives and learn to work with what it is that's going on, that's when we can see positive changes. So regarding stress, stress really is nothing more than a perception and judgment based on a person's unique experiences in life. If stress were simply, stress exists, but it exists individually for all of us. So what may stress you may not stress me, and vice versa for everybody else. So we have these stress tests. So if you move in the last year, add the number 30. If you divorced, if you went on vacation, if you got married, if you got a dog, if you lost a dog, and here's your number. Well, you have this much stress. Well, maybe I'm not stressed by some of these things. So it's a very subjective kind of thing. So I think that if we change our perception of our life experiences, we can then change the damaging effects that they can have on us. So ask yourself, what causes me stress? Why does it cause me stress? And how can I look at it all differently so I can reduce or stop allowing it to stress me? So taking that time to go out, just as an example, to spend time doing nothing, spend time talking with yourself. Ask yourself these questions in a very non-judgmental, peaceful kind of a way. So why is this information about stress so important? This is an anxiety, stress, pain cycle. So when we have these fight or flight sensations, we have extreme physical and mental pain. When we're in that state, it's hard to think clearly, so we misinterpret the signals that are coming to us. We then panic. And then we panic over how the body feels. Our heart's palpitating, our legs are shaking, we're feeling weak, we become afraid of those sensations. That then creates more adrenaline, which is the stress hormone. That stress hormone then creates the cycle, more fight or flight, and it stays that way. The key thing is to break that. So here we have 2 people, 3 people. First one's just like, I'm out of here, screw it, I'm running. The other one said, I must be sick, I must be going crazy. One day having a stroke, and we're constantly living in that state of mind. It's not going to work. And we have Mr. Catastrophe. What if this never goes away? What if you collapse? I need to go to the ER right away. And so if we're in this mindset and we see our doctors, a lot of times they go, I'm just anxious. I'm like, no, I'm dealing with pain, I'm dealing with this, but we have to kind of break this cycle on how we present ourselves in those situations. But generally speaking, this is what this creates. And so we have to work hard to break this cycle the best we can. So how do we do that? So we're dealing with pain, be it physical or emotional. We then become very mindful of it. We simply become aware of the fact that I'm in pain, I'm experiencing whatever it might be, discomfort. When we can do that, we can then breathe, a nice cleansing, healing breath, we have less muscle tension. In relatively speaking, because of dystonia, it's a bit different, of course, but it can help to reduce muscle tension. Then we have less stress and less anxiety. That helps us think more clearly. We can choose our activities and our decisions. We can make them more wisely. We then hopefully have less pain. We feel more in control. That's a huge thing for us because we have an involuntary movement disorder. So it's very challenging. So we want to feel in control, to give ourselves a greater sense of well-being, to get confidence, because lacking confidence is a big thing when you have a body that decides to do what it wants to do as if you're a marionette and you're being controlled by something else. So you need to have this sense of confidence that your body can and will respond well in all situations. And to help me when I'm going kind of running through life, I like to use affirmations. This is one of my favorites. It comes from the book by Louise Hay called You Can Heal Your Life. And it's I relax into the flow of life, and life flows through me with ease. And I like this one because of the word relax and the word flow. And we're going to be doing some dancing at the end of this. And the flowing movements of dance and the flowing movements of any kind of flowing movements, but the word flow for me, or melt into the place you want to be. And then life around us will flow through us with more ease. Another affirmation I came up with on my own I like to use, and this one covers the mind, body, and the heart. And I think of heart, I think of spirit as well. So my mind is clear and calm. My body is balanced and at ease. My heart is loving and pure. And I did these 3 because my mind can sometimes be so scattered and ruminating, thinking and worrying and all this all the time. And I actually will say that with my eyes closed, and I'll say it to myself, and I'll visualize my mind being completely empty, a completely empty vessel. And my body is balanced. I always want my body to be balanced because I have dystonia. My body is imbalanced. My muscles are imbalanced. And so all the activities I do in my life, I try to be as balanced as possible. So I try and stand straight. I try and face people and do things. I try and do all things straight and centered, everything. So I want to be balanced in my mind. Hopefully it'll help in my body. And at the end of that, you can say at ease, or my body is balanced and asleep. My body is balanced, and whatever it is that you want. Affirmations are positive, affirming statements of what it is that you want, not what you don't want. And so this is what I shoot for. My body is balanced and at peace, at ease, asleep, or whatever it might be. And then my heart is loving and pure. That takes away the anger, bitterness, shame, all those other jealousy, etc. That we have. My heart is loving and pure. Love is the most powerful force in the world. If you can be loving and pure, the rest of the stuff goes away. It's not as easy on making it doesn't make me sound, of course. It's a daily practice. So breaking away from stress, there are many things: massage, acupuncture, movies, books, prayers, positive thinking, affirmations, like I was mentioning, meditation, physical exercise, music, dancing, mindful breathing. And again, I'm going quickly. I understand. I'm sorry if I need you to slow down. Just let me know. What's that? Okay, I may have to. Also, it's very hard for many of us to sleep, but if we get onto a regular sleep and wake cycle, that's very, very important. A lot of people like shopping, doing fun hobbies as well. Those things are also ways for us to break away from stress, and also trying to find quality time with friends and family, and being in environments like this around people that get you and understand what you're going through and are going to be here for you, like this guy, all the time. And I don't mean that lightly, because we need more people like you. Doing good deeds, because the flood of endorphin from doing good deeds, it gives that helper's high. So that creates a flow of endorphins and serotonin. Being around animals is very helpful. Saunas, hot tubs, some people don't like these things, but these are just suggestions for things to try. Nutrition, of course, the anti-inflammatory foods, many of what Joan was talking about, is very important. And of course, sunlight, was another thing that she mentioned. Vitamin D is extremely helpful, whether you take it or you actually inside it in the sunlight. And laughter. The brain doesn't know the difference between fake laughter and real laughter. So sometimes if you just laugh and you're not feeling like it, it can turn into real laughter. But laughter is a really helpful way to break away from stress. And learning how to, as crazy as it sounds, develop a healthy relationship with your pain. Learn to become friends with it. Don't look at it as something that's outside of you. It's a part of who you are. So if we can learn to accept it like anything else about ourselves, the fight, the internal fight we have won't be as intense. So that leads me to this, of course, to stop fighting against it. So when we choose to stop being angry, we give our body a better chance to heal, because we create that internal environment that I was mentioning before of peace and harmony. And that's the key thing. We can't heal. It's physiologically, chemically impossible to heal if we're not mentally and emotionally at peace. And I promise you that there is no amount of anger that will ever take away your pain. It will actually cause more pain. Venting and letting it go is great, but if you live in that state chronically, it's not going to help. It's going to make things much, much worse. So be really careful about your emotional state of mind. If you need help, of course, there are many people out there to support you, to work through these things. I know, I've been to people and I help people, and this is something that I think is a critical aspect of our healing. This is a quote from my book. We can't change anything until we accept it. We have to stop saying that this life of ours shouldn't be this way or that way. It should be this way. Why? Because it is this way. So we have to stop resisting what is, move forward, and do our best to make great things happen. So when we resist the flow of life, how does this look and feel on the inside of our body? Like this. Who wants to live like this? How do we want the inside of our mind and body to look and feel? I'm not sure what these next images will evoke for you emotionally, but a lot of people see these pictures and they go, ah. I have a collective ah. Thank you. This is actually a beach not far from where I live. I took this picture. It's one of my favorite pictures I've taken. And I try and visualize these environments. I try to get into these environments. And if you live here, I don't live here, but if you live here, I've never been before, it's beautiful here. And to get out in nature, there's just an endless supply of it here. Nature for so many people can be so grounding. Now, if you're a fan of the mountains, this is another part of the country where I also used to live. I used to live on this lake as well, another moment. And this is a river right near where I live, actually. This is where my mother runs, by the way. I like to go down there and take sunset photographs. And if you happen to follow me on Facebook, I post them all the time. And I've got a lot of them over the years from various locations here on the river. And here's another one I took as well with some beautiful colors. That for me, these are the kind of images I try and create in my mind by focusing on peace and the healing and the calming aspects as much as possible. So here's what's really important. It's not what happens to us in life that defines us and how we feel. It's what we do with it that defines us and determines our character and how we feel. This is a quote from my other book. None of us are immune to the challenges of life. When adversity comes, how we respond to it determines what happens next. Life experiences become tragedies if we make the conscious decision to make tragedies out of them. If we choose to view all challenges as opportunities for personal growth, they can be a driving force for positive change. And I just love this little girl's picture, she's so cute. But we kind of sometimes have to really go through the storm so we can really dance in the puddles. And we can have some fun and play. So one of the main components to working with our dystonia and pain, again, pain referring to emotional or physical, is self-care. So why self-care? Well, our doctors can only do so much for us. They don't eat for us, they don't sleep for us, they don't manage our stress, they don't choose our friends and other things as well. Those are all in our power. We have to be mindful of those things. And there is so much more to our overall well-being than just treatments. So the majority of care really must come from ourselves. And increased self-care enhances feelings of self-empowerment and confidence, which helps us gain more control. And again, when you're living with a movement disorder with involuntary movements where you're out of control, to get that control is so important. To get that confidence is so critical. So everybody needs to find the unique puzzle pieces to their unique self-care puzzle. So for me, that includes eating well, exercise, quality sleep, stress management, massage, healthy relationships, quieting my mind through meditation, prayer, and breathing exercises, listening to music, being out in nature, resting at the pool or at the beach or anywhere outdoors, refraining from activities and events that overtax my body. So setting and respecting boundaries. Shutting off the computer and phone and taking those mental breaks. Reading inspirational books, watching favorite movies and TV shows, not beating myself up for not being the person I once was and embracing who I am now and making the best of it. And avoiding toxic people and spending time with people who lift me up. Now, if you struggle with self-care, which many people do, treat yourself like someone else you are responsible for taking care of, and then give the same to yourself that you would give to that loved one. It's not selfish to take care of yourself. Saying no is a big part of this. We have to be okay with the fact that we can't do everything and we can't please everyone. When we set boundaries and we give more to ourselves, we can give a better version of ourselves to others. Because people get the best of you when you give yourself the best of you. So don't ever lose hope. Don't ever give up. Because the day we give up, the day after might be the day our life changes. And I love this little guy with the helmet on. Never give up. He's gonna get that cheese one day. And please understand that the diagnosis of the dystonia diagnosis is not the definition of your life. It is not the book of your life. It is just one chapter of your life among many other chapters. And while it can alter the course of your life from, can't even see down here, from subtle to dramatic ways, it need not be how you define yourself. It is not what happens to us in life, like I was saying before. It is what we do with our lives that define us. And this can go for anything, so not just dystonia, but any other challenge in life. It doesn't define you unless you allow it to define you. So when I was really struggling, I said to myself, I do not know why this all happened or why I go through this, but I refuse to go through this for nothing. It took me a while to get to saying that, to this point where I can say that. So I had to find meaning and purpose, and how did I do that? I went back to school. Originally, I wanted to be a counselor. But I got certified as a life coach, and in the area of health and wellness, I became an author of 2 books. I've written articles that have been published all over the world. I've become a speaker and an active patient advocate for dystonia, pain, and mental health. These are some of the places that I've been published for some of my articles. There's more than just this, but like I said, I've been in many, many places around the world. I've been on different podcasts, international radio shows, and different things. So I just wanted to share this with you. It's actually kind of embarrassing to just share this kind of thing because I'm not the kind of person to say, hey, look at me, look what I've done, sort of a thing. I don't like that kind of I'm just not me. But I'm doing this because of what I showed in the very beginning of how horrible it once was. And through hard work and discipline and stick-to-itiveness, I've been able to accomplish a lot of really cool things. And so to be able to stand up here and speak with you when I used to live on my floor for 5 years, rolling around in pain, sucking back beer to try and get through the day, to stand up here and talk to you is, to me, the best thing I could ever ask for. And that's from just being dedicated to the things that I found that helped me, which may not be the same for you, but by being dedicated and never giving up and finding what may help me to get to where I am now. And in addition, of course, as I've mentioned, I've written a couple of books as well. And if you have them, I hope you're enjoying them and they're helpful. And if you don't, I have some back here you can get. I just want to say thank you very much. If you'd like to contact me, this is my information here. That's my website. I'm also on Twitter and Instagram. And feel free to reach out anytime about anything at all. And I am always there. So thank you very, very much for having me, Dr. Hogan. I appreciate it very much. Thank you.
That was absolutely phenomenal. This is a message, talk that not just people with dystonia, but every human being should hear. And this Zoom is being recorded. I think it's reversed. You may have to watch it in the mirror, but it's being on the screen here. But either way, it's going to be available, and recorded because all this messages today really can change a person's life to the better. So it's fantastic. So Tom has his books in the back. Joan has her nutrition for brain nutrition also available. Sell costs for anybody who like to find a nutrition book. And so then we're going to have lunch. And again, we have questions. And if anybody needs to buy utensils, to support the Dystonia Medical Research Foundation, Marty's back there that you can get utensils from. Otherwise, we have possible ones over there. And then we can come back in and network somewhat, and then have in maybe about 45 minutes in that area, we can sit down a little before 1 o'clock. And even if you're done with lunch or if you're having your desserts, we can watch some tremendous art videos from Naomi and Miles that we'll be watching, and then we'll have our little discussion on sensory tricks. And really would welcome people's input on that. And then we'll have a question and answer period. And then try to participate, come in, and even if you're just standing, enjoying some dancing, get some movement. It's so important. So thank you very much for being here and enjoy your lunch. Do
you want to mention that we're going to try to reconnect?
Oh, that's right. Yeah, so we're going to try to, just for people on Zoom, we're going to try to reconnect again afterwards, but we're going to put it on pause now during lunch. May not reconnect, but I think if people that are on Zoom, I think Zoom, we've got the gist of everything we've talked about, especially with Tom's lecture. So thank you much. Enjoy it. It was great.